A hearty welcome to all. We will start in a few moments. First of all, I would like to announce that our medical director and principal, Swami Shankara Amrita Puri, has arrived, and we will start the deliberations in a few moments. I would now request Swami to initiate the meeting.
Om Namah Shivaya. I will start the proceedings with a prayer from Saundarya Lahari. Om Avidyanamantastimiramihiraddvipanagari Jadanam Chaitanyasthabakamakarandasrutijharim Daridranam Chintamani Janmajaladho Nimagnanam damshra muralipuvarahasya bhavati. Om Namah Shivaya. So yesterday, I am presently in Amrita, the headquarters of Mata Amritanandamayi Math, and I am in the Institute of Amrita School of Ayurveda in our laboratory. Yesterday there was an inspection to evaluate our status in Institute of Eminence at Amritapuri. 16 of the vice chancellors of various universities participated. As it is happening nowadays, there was no direct visit, which was not possible. It was all virtual through technology, through Google Meet, and our campus is spread over 6 places. Those vice chancellors were from different places, and there was a meeting with our chancellor, Srimata Amritanandamayi Devi also. It was planned for nearly half an hour. She was supposed to give a small talk, and that was what was expected. But somehow that turned out to be a big conversation between the vice chancellors and Amma for more than an hour. The main topic discussed was not about the university, but about the corona and all its effects in the society. Most of them were concerned about the financial difficulties that all the universities are facing. Not only the universities, but also from the smallest business people and to the biggest companies. We are all facing a kind of a financial crisis, which has never happened. Many of them were stating that this kind of a situation has never happened before. They have not seen it in their lives. So secondly, the depression that it is happening amongst the students as well as the others, the uncertainty, the anxiety, the wrong information, many of them are right informations about corona was discussed. It was out of agenda. It was not planned actually. They didn't want to discuss about corona with the chancellor of an university whom they are supposed to inspect. But they were all seeking advice from Mama about how to face this situation, about these two things mainly. the financial difficulties that everybody is facing. The second one was about the mental depression that is being caused by this pandemic. So these two challenges are really very serious. I'm also very much fed up with the word corona. I don't want to use that particular technical term because we had been only chanting that mantra for the past nearly 4 months. But there is no other way other than us to discuss it in detail. Amma was suggesting that the scientific community as well as the leaders of the society should discuss it very frankly and openly and find out to whatever extent, if it is a small help, like the psychologists and psychiatrists and counselors, spiritual people should come up, should open up with solutions, and they should work within their circles and outside, so that it percolates to at least to their circle. The psychiatrists should offer themselves, should volunteer themselves to counsel the students, at least through online, by various methods. If it is not possible through video, it should be through audio. I was also suggesting that even in the advertisements, the commercial advertisements also should contain some spiritual message, a small message for the society, because everybody is watching the commercials. The only possibility is the entertainment channels, to relax a little bit. The theaters and others are not yet open. So Amma was suggesting that a small instruction or a small advice or a possible solution should be advertised along with the commercial products. So there is no other way other than to try and help the people who are suffering in the society. Even normal people are getting more and more depressed, especially the children. In the houses, the parents are not able to manage them except to give them some phones and show them some cartoons, which is not exactly a good solution. So creativity, we can talk about creativity, but utilize time 24 hours, 365 days in creativity alone. It's not possible for a big society. So Ayurvedic people, when we define through Ayurveda that it is not the physical health alone, but also the mental and spiritual health should be also considered. We have a big duty to come up with the genuine and the subtle ideas that are told in the text. We should not be restricted to finding some herbal alternatives alone. So we have a big duty towards the society in this critical juncture. So I'm happy that the people who are already working in this area, who have already treated the corona patients, so they can have more confidence. In Kerala, we are not supposed to treat the patients who are positive. The government legal obstacles are also there. Even whatever we are recommending or talking, they are all theoretical, not exactly tested in corona patients. We were discussing, I was discussing many times with Dr. Ram Manohar, Dr. James, and Dr. Delvin, who are all actually involved in treating this particular condition. there are many good ideas, the classifications and the thoroughness with which the Ayurveda describes about the Vishamajjaras, also about the infections, Samsargaja Rogas. I understand that the term Bhuta consists of infective organisms as well, which are all very interesting. I also believe that keeping the body in the most clean way, Dhatu Shodhana is going to help us. So the internal as well as the external cleanliness, hygiene also is going to help us. The spiritual practices are also, actually, yesterday was the beginning of Chaturmasya, the beginning of a time in which we practice penance and spirituality and vratas. So this is a Ramayana Masa in Kerala, so where Ramayana, Parayana, etc. are usually being done. Now no sound is heard here. This is all affecting the society very much. There are no Bhagavata Saptahas. Whenever we land down in Kerala, the first thing I note and hear is the beautiful singing of Bhagavata. At some point, from a distance, we used to hear. To people of all religions, their worships are being obstructed, and it is affecting their minds. The music is only through Facebook and YouTube channels, which is not equivalent to live music. So relaxations, games. The cricket lovers of India, they are deprived of their main entertainment. So, what best we can do in this scenario? I hope this discussion is going to help. I hope everybody shares their experiences and ideas. I'm also keen to listen to all of you. I've been listening to the, even though I'm a little bit, I'm becoming allergic to the particular word corona. Today I feel I should listen to all of you. So with these few words, I welcome all of you for this program. I hope it will benefit the whole society. I pray to Amma that all good things should happen immediately. Sarvakshemam bhavatu is my prayer. Thanks.
Thank you, Swami. So I think with that we will start our deliberations today. Yesterday we had shared the protocol so that we have 3 rounds where each analyst will respond to the questions that we have prepared. We have already circulated that earlier. So in the first question, we are going to ask the 2 clinicians, because this is one reality that is coming up today that I heard from Dr. Jyoti. Dr. Girija Madam was the first Ayurveda doctor to report a case study based on a patient, as early as April, when we were just beginning to handle it. And Dr. Jyoti Joshi has also been treating a lot of patients based on patient requested. So first we will hear from both of them. I would like to start with Girija Madam. So what type of patients come for consultations? Are they coming voluntarily to your hospital, or are they also being referred by Ayurvedic practitioners? What level of seriousness do these cases present with? What is the background? Can you please share your experience?
My very first case in Chennai was recommended by an allopathic doctor. He's a senior diabetologist. That was a very critical case. I thought I may not succeed in helping that patient. Subsequently, we had a lot of cases. Now we are edging close to 100. In that, the major portion would be mild and moderate, as it is everywhere. As such, mild and moderate cases are what is being presented. But I can give you examples of some very vulnerable, risky cases which Ayurveda has handled and which has been acknowledged by the Western medical practitioners who referred them to me. Not, I wouldn't say me, I'm sorry, all of us, we are handling it here. And so the general saying that Ayurveda is handling only mild and moderate, so anyway they are self-limiting, that is not a valid argument. And if I have time, I can explain the other cases. Can I go on?
Yes, yes, please.
So the first case was referred by a senior diabetologist from Chennai. Then he told me that I don't trust Western medicine with this patient. One dose of that hydroxychloroquine will impact her kidney and she will be finished. So I'm referring her to you. She was diabetic and on insulin, and she had chronic kidney disease. 3 times a week, Monday, Wednesday, Friday, she was going for dialysis, and she had a tumor in one of her breasts, which she had not done a biopsy to do anything about it. She was on somebody gave her some medicine from North India, some Ayurvedic medicine which she was taking, and she was hypothyroid. And on top of this, and she has a history of being treated for tuberculosis at some point, and she became COVID positive. Now, for a COVID positive patient, no dialysis unit would come forward to do a dialysis unless they become COVID negative. So 3 times a week dialysis has to go on. Anyway, we started our treatment. She had some mild fever, some cough. She was always given to diarrhea. Always she would have loose motion, semi-solid motion like that, and very weak. So after some time, the days kept passing. So no unit would give her a dialysis. They tried about 70, 80 hospitals in Chennai. They would not take her unless she tested negative. Then finally, on the 8th day, they found a small hospital. At what cost they admitted her, I do not know. They admitted her in the ICU, and either 8th evening or 9th morning, she had her first dialysis. But 10 in the night, I got a call from the doctor who referred her to me, and he said, when they tested her blood, they found the creatinine had gone up to some 14, and her something else also, urea was high. But he said there are 2 factors which are very crucial for a kidney function, namely the potassium level and the bicarbonate level. And the Ayurvedic medicines had kept that kidney going extremely well. That the 8 days that she did not have dialysis, nothing happened to her kidney. It was functioning very well. Then they went ahead and did the dialysis. And then on the 13th day, her COVID test came negative. So this was a very, very critical case. One would think that if she had missed 1 dialysis, that she would be in a difficult situation. Here she missed 3 dialysis, and then on the 9th day probably she had her first dialysis. So this was one of the cases which goes to show that Ayurveda can handle very critical case. There's another one referred by an oncologist. The oncologist, this is in 2019, the patient had oral cancer, and in 2020, it spread to lungs and bones. and he was going through chemotherapy. In the middle of the chemotherapy, he became COVID positive, and the oncologist referred the patient to us. And this also, in less than a week, the oncologist called us again in one night and said, my patient has become COVID negative, and thank you very much. So that was the second case of, here it must be called an immunocompromised or whatever. Then there was another case. When we talk about age, we would say that 92 is a very advanced stage. And at 92, he was permanently on a catheter because he had had a burn injury in the genital area, and then urine wouldn't flow, so he was 24/7 on catheter. And he also was treated for TB, tuberculosis at some point. And then he had diarrhea for 1 full week, 4 to 5 times a day, mild fever. And he also he had undergone a bypass surgery. So he has all, I mean, this is not an easy case, but anyway, he also became COVID negative after Ayurvedic treatment. Again, we had one of breast cancer in the middle of radiation. She became COVID positive, and they had to stop radiation. She took Ayurvedic treatment, and she became all right. Now she's going back to her radiation. So when we talk about, I mean, generally, most of the cases we go in every hospital, it is mild and moderate only. There are some cases which are risky, which are vulnerable. And Ayurveda can treat it extremely well.
Madam, thank you very much for sharing your experiences. It's really heartening to also learn that Ayurveda can deal with challenging cases. Now I would like to go to Dr. Jyoti Joshi. Dr. Jyoti.
Yes, sir.
Yes. So can you share your experiences, respond to that first question? What type of patients have been receiving? Are they referred by allopathic doctors also, or are patients coming to you on their own? And what type of patients are you dealing with?
Yes, sir, sure, sir. Namaste and pranam, everybody. So, myself, Dr. Jyoti. So, I have my practice and I'm working since last 5 years. And there are few patients who actually believe that they are just only dependent on Ayurveda only, that though it's acute condition or chronic condition, they just believe that Ayurveda has a cure and they just approach me. So same for the COVID. So there are total 5 patients. They went somewhere and they got infected and they diagnosed as COVID positive, and fever initial, like starting from day one, the fever, then thereafter breathlessness, cough, weakness, every type of symptoms were there on those 5 patients. And I started with that 5 patients. And the one female patient, she was actually from Alibag, nearer to Panvel. And from that civil hospital, she referred to MGM Hospital, Kamote, and the patient's oxygen saturation was very unstable. She was on, like, O2 saturation was around 80, and thereafter on same night actually she was on oxygen and some other drugs, and thereafter we have all the records of these patients, and thereafter they approached me for the same patient. I was not knowing that patient, so I did online consultation, like audio, video, everything, and she was 26 years female. And thereafter, we started with our Ayurveda treatment. Basically, Patha, it is very difficult while patient is admitted in government center or some isolation center to advise a Patha. But I asked them to just do not eat anything unless you have hunger, like langan as much as possible, and with some few Ayurveda.
Dr. Jyoti, we have lost your voice.
because she gave me confidence, and she was already confident that yes, I'm improving. I don't need any allopathic treatment. And thereafter, the journey starts with Ayurveda and COVID. And now, till date, we have more than 50 successful cases of COVID. Like COVID positive patient. Now the question is that am I audible?
Yes. Now
Am
you're
I?
audible.
Yeah.
Yes.
Yeah. So now the question comes: what type of cases I'm looking at in my clinic? So I can say mild, moderate, and severe cases as well, who are already in hospitalized, but they are on Ayurvedic treatment, because here they like cooperating all the ICU and allopathy doctor that yes, you can give Ayurveda treatment as well, because they have some their limitation. So it's become easy for me to treat. And now we have. Am I audible, sir?
Yes. Please go ahead.
Yeah. So now we have all the cases that actually recovered with Ayurveda treatment. So I was. It become very difficult to advise the patient to the diet when they are in government hospital, but we ask them to have the lahi, that popcorns of jwari and rice, and thereafter lasun, and with some basic principles of Ayurveda. If time permits, I will explain how I advise the diet and how the cases improve. But no allopathy doctor referred the cases to me. But as I started, if patient approach, and when I have words with those ICU in charge and all, they are not like they are not asking me to stop or something. They are just cooperating. Yes, ma'am, you can carry on. And it's patient wish that he or she don't want to take allopathy treatment. Like one of the patients, she refused to take Fabricue and completely recovered with the Ayurveda treatment. And we have all the documentation of that case.
Okay, thank you. The treatment part will come later. Now, I would like, it's very interesting to see that Ayurvedic practitioners are getting opportunity, especially I think in places where the COVID patients are in large numbers. Patients on their own are approaching. Girija madam was explaining that even allopathic doctors are referring, whereas in this case, even though they are not referring, they are cooperating, which is a very good thing. So now we will go to the institutional setup, and I think it was Chaudhary Brahma Prakash, which I think started off by admitting, COVID-19 patients in their facility. So I would like to hear from, we would like to hear from Dr. Pooja. I mean, what type of patients are referred? I mean, can patients come on their own, or they have to be allocated to your hospital? And is there any criteria for what type of patients you accept or how you refer them? Because in an institutional framework, it's not like a private practice. So can you please explain how it is in an institute?
First of all, namaste, everyone. And at the outset, I would like to extend my greetings and to all the respected panelists and experts, and my sincere thanks to Dr. Ram for giving me this wonderful opportunity to interact regarding my whatever the experience I have with the COVID patients at my institute, that is Chaudhary Brahm Prakash Ayurved Charak Sansthan. Actually, CB PACS, my institute, actually, it is a dedicated COVID healthcare center since 18th April 2020. And it has been declared by Delhi government as a dedicated COVID care center for moderate category. So since beginning, we have received patients from asymptomatic category to mild to moderate category. So we are admitting the patients after their initial assessment criteria, and the patients, they are not voluntarily coming to our hospital. So as I said, that it is as per the protocol, our center has been declared by Delhi government as a COVID care health center for moderate category. So all the patients who are coming, so they are coming through proper channel with the proper referral system, and his or her information, patient's information, should be there in the to the authorities of the of our center. So he must carry the referral card in his hands, and then only after initial assessment we are admitting the patient. So yes, we are admitting the patients with from asymptomatic category to mild to moderate category. So after their initial assessment criteria, like their oxygen saturation level, age, comorbidities, etc. So these kind of patients we are admitting here in our hospital.
Okay, thank you. So now we will go to Dr. Prashant. He's from the All India Institute of Ayurveda, and the All India Institute of Ayurveda has also now been, set up as a COVID-19 hospital for offering Ayurvedic treatment. So, Dr. Prashant, would you be able to explain what type of patients come to All India Institute of Ayurveda? How are they referred? What is that system of referral? And what type of patients do you accept, and how would you, on what conditions would you refer them, for allopathic care?
Namaskar. First of all, I think I am the most luckiest participant among all of who are here. I have my former medical director Shankar Swami along with my present director Dr. Tanuja Madam here. So to begin with, namaste to all the senior panelists and all my team members from Amrita and all dear colleagues. So it was really panicking in the beginning when COVID started, but somehow the leadership that we had here always encouraged us to take up challenge and find an opportunity in that. So with the the kind of vision that Director Tanuja Madam has opened to us, we actually started trying ourselves to be a COVID center. And as we always tell, we should appreciate the Delhi government for allowing us to start with the Ayurveda management. So we are actually, assigned as a COVID health center. Being a COVID health center, we are basically dealing with asymptomatic cases who are positive, and mild cases and moderate cases. So there are specific definitions by ICMR for mild and moderate cases. So we actually follow those protocols to find out, to screen these patients who are asymptomatic, who is coming with a test result, and mild cases and moderate cases. So these are the three kinds of cases who we are admitting here. The second question that you raised was, sir, was about the policy of admission and policy of reference. So the policy of admission is very simple. We have kept it hassle-free and patient-friendly so that more and more people can come and get admitted. But still, we have three tiers in it. One is a direct CDMO reference from the Central Delhi Medical Board. They refer the patients who are corona positive to specific centers which are nearby to them. So there is a government referral system wherein they send the patient irrespective according to the geography of the patient. So there is a nearby location. We screen them whether they are fitting our category of being mild, moderate, or asymptomatic, and then we take them according to the admission policy that we have framed. The second thing that was asked was about the referral policy, sir. The referral policy is also very simple. We have been assigned a specific hospital, like for example, we have a hospital called Rajiv Gandhi Hospital. So we have our ambulance service arranged here, which is 24/7. So any patient from the mild or moderate level who's going to a critical level or an emergency level, he can be referred at any point of time from the hospital. So the facilities are completely arranged so that by God's grace till date, only we had to refer one single patient from our hospital, and rest everyone was really fine, happy, and all of them are getting negative. So I think basically to begin with the introduction, what I understood is after going inside is that this fear should be removed. That's what my elders have taught me. This is just another viral fever. There is nothing other than that, like the media hypes. After seeing and managing asymptomatic, mild and moderate patients, what I understood is this is very simple and easily manageable, very well responding. So that fear from the society, that is the primary thing which should be removed, because I think media is playing a vital role in doing that. So I think I could answer the first three questions that you have asked, sir.
Thank you, thank you. How many patients are there in the hospital now?
We are having a 40-bedded CHC facility in the premises. Right now, we are approximately having 22 patients in the hospital admitted. Already around 20 patients are discharged who are negative. One of the patients was referred by an emergency condition wherein his SpO2 levels are constantly falling down. But he was physically fit, but then we don't want to take a risk of giving any kind of problem to the patient. So considering his safe asset, but it was easily manageable. That was the fact. But then considering the protocol and the benefit of the patient, we had to refer him because we wanted to test all the emergency services, ambulance, everything. So we referred.
Okay, thank you, Dr. Prasad. We'll come back to you again for more details about what's happening. Now, I would like to request Dr. Pavan. Dr. Pavan is, involved as a PI in a clinical trial, and he's also attending to some COVID-19 patients. So we talked so far about the clinical care, at the level of practice, but can Dr. Pavan talk about also when you move from a clinical setting, practice setting to a clinical trial? How are you approaching it? What are the inclusion exclusion criteria? Where are we allowed to give the treatments, and how do you decide whether our treatment works or not? And maybe without disclosing too many details, if you can also tell what stage the study is at this point of time and when we can get some outcomes.
Thanks a lot, Ramji and Swamiji. My pranams and my pranams to all the elders, Tanuja madam and everybody else. It was a great opportunity to be in the mix of action, what is happening all over for Ayurvedic sector. For the research angle, there has been a lot of hurdles. Everybody is acknowledging that we didn't get the required permissions. Then there are ICMR protocols and guidelines and everything. And state government and central government tussle is also there in Rajasthan in permission part of it. So we had applied for SMS Medical College also as a collaborating center. But what we got permission was from All India Institute of Medical Sciences, Jodhpur. The protocol was standardized by the task force, and we are using the drug Ayush 64 in the add-on group. So there are two groups. One is the standard treatment group, and in one group, Ayush 64 will be used as an add-on therapy to the COVID-19 patients. And inclusion criteria, when we started, they are changing the guidelines every day, but still now the actual case definitions remain the same. But when we started, the protocol for treatment for confirmed COVID-19 hospitalized patients, because we are supposed to work with AIMS Jodhpur in the hospitalized patients, and we took at that time the state and group. The terminology used was mild state, that is one. They were given 3 grades, 1, 2, 3. So we will be dealing with only mild group of patients. One, early infection. They were subdivided into groups A, B, and C. A is asymptomatic but positive for COVID. Investigations, others were CBC, RFT, RBS, LFT, and ECG. And site of admission was isolation ward. Now the new guidelines are there that asymptomatic patients positive for COVID-19 can be home quarantined also, but they will automatically move out of our inclusion criteria if they are not in the ward. We are doing in the ward itself, the monitoring of the patient. Group B is symptomatic URTI without comorbidity. That is, he should have fever, cough, sore throat, malaise, headache, anosmia, loss of taste, and diarrhea. Red flag signs, if developed, likely to deteriorate, were also there mentioned in the protocol, that SpO2 if less than 94% on room air, and neutrophil and lymphocyte ratio more than 3.5, and resting tachycardia is there, then we will shift that patient. We will not include him. Otherwise, he is in our inclusion criteria in the isolation ward. Symptomatic treatment such as antipyretic, adequate nutrition, appropriate rehydration, and whatever they decide. And on the add-on group, we will add the Ayush 64. In group C patients, which are also in our inclusion criteria, symptomatic URTI with comorbidities like obesity, more than 60 years, diabetes, hypertension, IHD, COPD, immunocompromised states, on immunosuppressive drugs, but we have put that on the we can say Vivek or wisdom of the co-principal investigator who is actually dealing with the patients. So from the All India Institute of Medical Sciences, Jodhpur. So
The
this is the
Ayurvedic
status.
is only Ayush 64. You don't
Ayush
do any other.
64 because that is given by the task force. And we are adhering to that. Right now, we have randomized 12 patients with 6 in each group, five in one group and 7 in not add-on group. So 5 in the Ayush 64 group and 7 in the standard treatment group. They are progressing very nicely, and the guidelines have now shifted. When we started, we had the treatment schedule for 1 month, say 3 weeks, 7 days. But now the window period has in fact shifted to 5-5-5. So we have amended the protocol accordingly. So now the
Okay.
treatment protocol is for 15 days. So actually it is reduced by straight half. That is also a good thing. So we are expecting some good results or whatever interim analysis in a few days. Say maybe
Okay.
2 or 3 days. Let's see, by next week we will have something.
Okay. Thank you. Thank you. So
Thank
I
you,
think
sir.
this is the contrast. Thank you very much. And you have also been doing clinical practice, so I'm sure you are aware of the different approaches that we are using in clinical practice. While clinical trial data may come out as publication, I think more effort will have to be taken to bring out the outcomes of clinical practitioners. They definitely have more freedom. They're able to see a wide range of patients. So I think that will also be very
And immediately check the compatibility of the drug and immediately change it.
change it.
Something
Yes.
else.
So
So
that's
if
a very, very good advantage.
yes.
So now
So
we would like
Shakti is not available.
yes.
And
Yes.
Dhanvantari and Talon is now not available everywhere. So they change very quickly.
So now we'd like to come back to the second round where we will discuss about the treatment approaches, because this has been a debate. When we talk about research, we are forced to give only one herb or one formulation to the patient till the end of the trial, and it's a very strict inclusion exclusion criteria. On the other hand, many of us have also been discussing about this. We cannot wait for evidence to come before we treat the patient. And so clinical practitioners, what they are doing is very, very important. So I would like to now ask again, Girija madam, how is your approach to the treatment? Are you following, because Ayush has given some practice guidelines, but what kind of approach are you taking in your clinical practice when it comes to treatment? I mean, how do you do customized treatment? Do you put diet along with it? And are there any other behavioral components that we would like to hear from you about that?
Ayush has given a very exhaustive list of medicine. I think most of our medicines fall within that, except maybe one or two. One, as I can think of, is where the comorbidity is diabetes. Then instead of Talisadi Churnam, we may use Triphala Saramudara Samhita for Swasam Kasam Jwaram. So otherwise, I think Ayush is quite exhaustive, the list they have given. The other question is, yes, we do have the advantage of not dealing with just one drug. This, first of all, we should take a position that our standard Shastric Ayurvedic medicine don't require to be clinically trialed. Therefore, I think unless you are using a proprietary medicine and a totally new medicine, there is no need for any clinical trial. The other question, Dr. Ram Manohar, can you once again ask me what was the other question?
Yeah. We were asking, like, are you customizing the treatment? Are you including diet, lifestyle components
All right.
also along with the treatments?
To some extent, we are. To some extent, in the sense, we have a printed form, which is also taken from the Ayush guideline. And then we sort of enter the whole data about the patient. And then we have a detailed telephonic conversation about the medical history as well as the presenting symptom of the patient. And then we sort of have, we shortlist some medicines. If they are with fever, all of them are on, when they come, they are on paracetamol. So the nature of the fever you cannot really assess because they are on 4 to 6 paracetamol a day. So they would say we are having 100, we are having 99, we are having 101, we are having 102. So, but really speaking, their fever exactly you cannot assess, and not all of them have fever. So, when there is fever, cough, a respiratory trouble, maybe shwasam, then we use a set of medicines. When it is diarrhea and other things, so then we have another set of medicine. So it would revolve around a group of medication which will back and forth. Sometimes we give a kit so that if in case they require, then we will say you use this medicine, otherwise do not use. So this is the kind of, and diet is absolutely important for us. We tell all of them, have parboiled rice cooked and strained, watery moong dal with dhania jeera as just crushed and added to it, and nothing more than that. If they don't have fever, then we say, okay, have some boiled vegetable, little bit. No tea, no coffee, no milk, no other in between food. You eat only this, and until and unless all symptoms are resolved. Thereafter, then we follow a slightly different diet pattern, and we change the medicines. After all the symptoms are resolved, then we tell them you come and we recommend some for medicines, a slightly different set of rasayana medicines. So this is how it is made.
So in some patients may be non-vegetarian. Are you also telling them to completely switch to a vegetarian diet? Or?
Well, whatever they are, we tell them while the symptoms are there, it is laghu aharam. Not even much vegetables we recommend. We just tell them moong dal and parboiled rice, cooked and strained, largely that only. Otherwise, if they are non-vegetarian, after all the symptoms are resolved, we tell them fat-free meat soup you can have. That's how it has been.
Thank you, madam. So yes, so I think one another thing is, many of these patients come with different sets of symptoms. I mean, some have gastrointestinal, some have respiratory. So how did you encounter such variation in their presentations and the need to customize treatments accordingly?
Yes, we definitely did that. Mostly they revolve around either diarrhea, fever, otherwise cough and sometimes shwasam and fever. Then we customize it also according to other comorbidities. Like a person with diabetes, as I told you, we would much rather choose Triphala Pipili to Talisadi. Then if there is diarrhea, then we would use like Dadimastakam, Kudajarishtam, depending on the patient. So customizing is very easy when you are not on a clinical trial. In fact, when we met the director of medical education in Chennai, and then this was earlier, and we asked them if we could have patients treated with Ayurveda. He said that's not possible. First of all, you have to try only one drug, one single drug, and so then I asked, and then you have to, it has to be add-on along with allopathy. So I asked, are you giving only one drug? No, they are not. They are giving 6 drugs, that is paracetamol, zinc, and 2 antiviral, antibiotic, hydroxychloroquine, vitamin D, vitamin C. To this, he wants us to add our set of medicine. I said we are not willing to do that. And they are also not giving one drug, and all these drugs are not proven to be effective for this condition. Whereas, so this is the situation that was in Chennai, but word of mouth, because our center is known to Chennai people, and word of mouth, people have started hearing, and then that's how we have about 100 people now, nearly 100, about 96, 97, I think, getting treated, all of them doing very well. Out of that, I think we have finished about close to 90, we would have put aside the file. It's only another half a dozen of them currently going on.
Thank you. Thank you, madam. Now, I would like to ask Dr. Jyoti also to respond to these questions. What type of treatment protocol you are following? Is it your own yukti that you are using, customizing? How are you able to bring in diet and lifestyle into the treatment, especially when you are giving the medicines in hospital where patients are already in hospitals? So how are you, what is your approach? I mean, are you following any government guidelines or just following the classical approach?
With due respect to Ayush protocols, but in my day-to-day life practice during COVID since last 2 months, it is difficult to stick to some protocol because patients are presenting with very different symptoms and with severity like mild, moderate, and severe. So it is very difficult. So first of all, the thing is, before coming to the medicine, I just want to convey that I just ask the patient for 3 days strict diet, that is what to eat. All other should be stopped by the patient. That is the only jwari, like great millet roti, and thereafter with mint and lasun chutney. That diet should be followed by the patient. No fruits who actually which are from cold chain. So all the fruit should be stopped. So I just ask the patient for strict because Langan plays very important role. I've seen with Langan, the asymptomatic or mild patient who are not having very mild grade fever or something, the patient easily shows improvement. So Langan plays important role. So I have customized that diet that already patient knows. If the patient who got cured with our treatment, they refer my name to some other patient, so they know that they want to follow this diet. So I just ask them to about the diet. Thereafter, lifestyle, we just take SpO2 because most of in patients I do like consultation by audio or video call. So I just ask them to send the SpO2 temperature and their audio every 2 hours. After 3 days, we start taking their 500 steps, then 1000 steps, 2000 steps, and we check their SpO2 level, because in hospital, in modern hospital, they are just doing X-ray or CT scan if there is pneumonia and all. They're just repeating it like after 2 days or every day as well. I've seen in some patients. So it is difficult in if we just treat patient at home or by Ayurvedic way. So I just take the like asking them to give the audio and video, and by monitoring the SpO2 level. Customized treatment in yes, in moderate up to moderate, mild or symptomatic, then in moderate cases I've customized the treatment. But in severe and with some comorbidities, like I have one patient, she was 60 plus and she's had a history of breast cancer. So in those cases the treatment should be like whatever, it should be changed. And it's again another question is herbo mineral. Yes, I'm using herbo mineral preparations like Sukshma Triphala. It contains Kajali and the Triphala. In some cases where the pneumonia is high, like last ground appearance, there I used Rasasindur as well. So Rasasindur is also giving excellent result with some herbal preparation, and it is like Muhur Muhu. It's like a sublingual application of the Rasa Aushadhis. It gives excellent result in especially the where the pneumonia is developed and SpO2 is very fluctuating. So I've seen that it is giving very good results. I've used Shardhara them the other kashayam, like the Shamula Katutraya Kashayam, Amrutaram Kashayam, or Indukantam Kashayam. Am I audible, sir?
We lost you for a
Am I-
moment when you were talking about Shraddharanam. Can you repeat that part?
Yeah, so after following the 3 days strict diet and the strict that diet, lifestyle, everything, thereafter I just start with some kashayam and all. In initially 3 days, I just asked to follow. Am I audible?
Yes, 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 please.
Yeah. So for initial 3 days, I just asked to follow the strict diet and thereafter with medicated water with Chadanga Paniya. No other medicines. If it is necessary, if there is ground glass appearance, some Rasasindur or Sukshma Triphala. So that type of medicine, I'm just asked to take the patient. After that, I just after 3 days, within 3 days, actually patient recover their SPO to stabilize, and thereafter we start with as per the symptoms. But within 3 days, fever completely subside, and herbo mineral medication plays important role in ground glass pneumonia where it is developed. So that plays important role. Otherwise, herbal medicines are enough. Allopathy medicines, no, I just ask the patient to stop all the COVID-related medicines. I have not given the medicines with Fabiflu or Remdesivir injectables and all. It's purely Ayurveda treatment, but patient is like, in case of hypertension or some diabetic, so I just ask them to continue with the same drugs. But COVID-related drugs, no allopathy treatment. I just ask them to take only Ayurveda treatment. And till date, all the patients recovered with only Ayurveda medicines.
So I've seen many of your patients are in the hospital. So how is it possible that they stop these medications when they are prescribed by the doctors there? The doctors are allowing it, or the patients are, withdrawing?
Actually, sir, in Maharashtra or in Panvel, I don't know about whole Maharashtra, but in Panvel, mostly in moderate or like mild or moderate cases, they are just giving vitamin C, crocin, and some iron zinc supplement. They are not giving more than that, and HCQ. So more like many patients are not able to tolerate the HCQ. So with Sabar, Shardar and Churna, within couple of minutes, they can see the results. So there is no question that like allopathy patient, neither doctor ask nor patient ask me that which can we take.
Okay. So Girija madam, are you also using Rasa medicines with, you did not tell about that.
Yes, not in many. Where there is Shwasam, yes, we do use Shwasakutaras. And then where in fever, in some cases, we've been using Tribhuvan Girtiras. Usually, generally for our routine patients in our practice, we don't use. But in COVID, we didn't want to take a chance, and all our patients are, we did not provide facility for them because then our other patients would not come to our facility. So we decided we would quarantine them at home. So where there is fever, we were using it. Where there is no fever, we would not use it. So these were the only two rasa drugs we use, not anything else.
Okay, thank you. Now I'd like to come back to our institutional, environments, Dr. Pooja and Dr. Prashant. Dr. Pooja, I think, as the Chaudhary Brahma Prakash has handled the most number of patients so far from this group. Can you tell what is the number of patients that you have handled there? And then also, just respond to that second question. What protocol do you follow there? Is it as fluid as in clinical practice? Because here the clinician has a full freedom to decide what we just heard from them. And how is it done in an institution? Even if it's not a clinical trial, do you really have a freedom to, customize treatments, or do you follow some institutional protocol?
Yes. Thanks for that question. Actually, so today's current status is that we have 64 patients in our hospital, and we have 170 beds dedicated to COVID patients.
How many would treated so far?
Sorry, yes, it's more than 600.
Okay.
more than 600. And today we had, till date, we have 64 and 170 beds they are dedicated for COVID patients. And regarding the protocol, yes, Ayush protocol is being implemented in all target groups. Like preventive treatment is being advised to target group 1 for quarantine and home isolation subjects without corona positive test, and even for the health workers. And similarly for target group 2, that is the subjects with mild and moderate symptoms with comorbidities and the immunocompromised conditions. Symptomatic treatment has been adopted in a generalized manner as per the Ayush protocol. And for target 3, the vulnerable subjects, integrated care, that is the Ayurveda along with the existing medicines under regular observation has been advised. Means, for example, if the patient is with the comorbidity like diabetes or hypertension, if they are using their already prescribed medicines, the allopathic medicine, so we are offering, we are not stopping them, not withdrawing all those medicines. He is taking all those medicines along with the protocol which is being given by us. And for target group 4, that is for the treatment for recovery and rejuvenation, has been advised in a generalized way to the patients. And if I talk about initially when the Ayush protocol was not there, because as I have mentioned that since very beginning, our center has been declared as a COVID care center. So we have developed our own treatment protocol. Our senior professors who are involved 24/7, they have developed a very specific protocol, treatment protocol for the patients. And we have received really fantastic, very wonderful results, because, as I mentioned that more than 600 patients, and the cure rate is, if I talk about overall success rate, it is more than 80%, because as Dr. Prashant has mentioned that our hospital is also linked to LNJP and Rajiv Gandhi Hospital, and very few patients we have referred till date. We are treating the patient with our own protocol, which includes very simple, Sanshamni Vati, Nagaradi Kwat, and Amla ki Choorn and golden milk. And along with this internal intervention, the overall holistic non-pharmacological interventions we have offered, like the happiness therapy, music therapy, chanting mantras to combat the stress factor of the patients. And we are offering very sattvic diet to the patients. And so this whole package, has we have, with the help of this, we have achieved a very good success rate, and following all the general guidelines and the general treatment protocol. It's not really very much customized for every patient, but as I mentioned, that it depends upon the patient's condition, patient's comorbidities. Say, for example, patient's current status, like if he is suffering from constipation or diarrhea or, like any other symptoms. So we are offering them, we are intervening the duty doctor, the consultant who is present, who is, there with the patient. He himself is the best judge to intervene Ayurvedic treatment, any kind of Ayurvedic medicine. So that is how we are customizing. But overall, we are offering the generalized protocol that is developed. That is our own protocol, and in totality, we are offering the Ayush protocol guidelines for all target groups. As I have mentioned, 4 target groups being mentioned by the Ayush Ministry. So this is how. And if I talk about the herbomineral preparations, we are rarely using herbomineral preparations. So considering, because we are having the mild to moderate cases, so I think the herbal preparations are sufficient enough to treat all these conditions. And whenever the as per the national guidelines, after 10 days of stay with no history of fever from last 3 days, so we are discharging the patients. And if the oxygen level is below 90 and depends upon the comorbidities and the age, we are referring the patient to higher centers. That is how we are managing.
Thank you, Dr. Pooja. So let's come to Dr. Prashant again. In All India Institute of Ayurveda, what is the approach for treatment? I mean, do you use an established protocol, institutional protocol? Then diet, how do you approach diet? Are you insisting on particular diets? Is there an emphasis on vegetarian diet and any lifestyle measures? Because I think Chaudhary Brahma Prakash, we had begun seeing videos also of many other, non-pharmacological approaches being adopted. So how is it in All India Institute of Ayurveda?
So to begin that I should tell that the first and foremost thing here was that any consultant was given the ultimate freedom. Basically, any consultant who is actually coaching a COVID patient, because this was a very new scenario for every one of us. We had only had plans, but when we went inside, our director and a team of seniors had given us exact freedom to actually decide what we need to do. So I was one of the initial people to go inside. So what we did in the initial phase was to reclassify these patients into various symptoms, group of symptoms which can be commonly observed. So that process was really required to go and set into a protocol. So that was the initial phase. So first thing what I want to tell is that AIA was instrumental in actually making the practitioners guidelines. So all of us sat day and night during the COVID lockdown to actually bring out the practitioners guide. But when we went to the ward, there was something much different than like what Girija madam and Jyoti madam had already told. There was much different things than what we had actually imagined. So initial approach was very symptomatic. We directly approached with the symptoms of the patient, and I personally felt the difficulty, even though we had protocol frame for asymptomatic. It was a question: what should be done for asymptomatic patient, because he is COVID positive and nothing else. And mild to moderate also we had symptoms varying. I'll show in the slide. So there was different symptoms, but we very simply approached with the basics of Ayurveda management in Jora, in the specific symptoms, Shwasa, Kasa. We simply managed with the basic, symptomatic formulary. We based on the Ayurveda practitioners protocols that were designed. It was easy for us to choose the medications from that because we were all well planned with the same set of medications in the pharmacy. But then we also tried to explore the potentials of certain new things like, we started giving Vasa Swarasa, we started giving Guduchi Swarasa, we used Vyakriyadi Vata, we used Nagaradi Amritottaram, we used Jwara Chikitsa, sky is the limit. But still what we tried to do is, initially we tried to symptomatically approach the patient, and it was really overwhelming response from the patient. And now the classification process is going into and turning around into a protocol, which my director will be explaining. So initial part was the classification which we have done, and it was based on the practitioner's protocol, but we had to even extend beyond that, outside that, because certain symptoms were not as what we expected with the compilation of symptoms that we saw outside. So that was the basic thing that how we approached. And I think the second question was, are the treatments customized for each patient? Yes, initially it was a very, very customized individually based on the freedom of the patients. Now slowly our third to fourth group is inside. So we are bringing up protocols based on the experiences and the classifications that we have made from the beginning. And the next question was, are you using herbo mineral preparations for COVID patients? So actually, sir, herbo mineral preparation, even though we were dealing with asymptomatic mild and moderate patients, some of the patients, without any doubt, we had to use it. Like for example, there were certain patients with breathlessness, so we used Shwasa Kutara Rasa. There were certain patients with not having reduction in temperature. We used Vetumara, Surya Prabha. So like we used Rasa Aushadhis. It was not that we completely avoided it or kept it away. We used it, but very minimal. The usage of that was very minimal. Rather, we tried using like Swarasas, Arishtasavas, basic Pachana Aushadhis like Sudarshana, like based on simplified. We tried to approach the patient as simple as possible. And based on the question that you asked about the diet, sir, we have a separate integrated diet department here. Yeah, sir, we have a integrated diet department, sir. About the diet part that we want to explain. The integrated diet department had a challenge of devising 2 to 3 specific kind of diet based on the comorbidity of the patient. Like there was a Jwarahara common diet to a specific group of people. There was a specific diet for the diabetic with Jwara. So 2 to 3 different diets were planned, and based because we didn't have a large number of people or patients at the time, so we were able to manage that specifically, and that too gave us really good results. I think Dr. Tanuja ma'am will be explaining about that part also. So it was also really useful in containing this.
Swami has one question.
Dr. Prashant, are you telling the patients that it is just another viral fever?
Yes, sir, of course. Yes, Swamiji. Sorry, Swamiji. Seriously, what I felt was, Swamiji, the patients are actually traumatized by that COVID positive PCR test.
Once they are diagnosed with COVID.
They are like, it's like diagnosing cancer. I'm either going to die or I'm really infected. I'm going to infect a lot of people. They are like really scared because nobody is coming in front of them. Everybody goes with a PPE. It's like an untouchable. It's like our in Malayalam what we call it a time Tindi kuda tottu kuda. That happened right now with the COVID. So what we tried to induce was right from beginning. When a patient comes, we welcome him with flowers. We touch him because we are in PP, but we make him feel that no, there is nothing to fear. You are just having another fever because there is asymptomatic patient, mild patient, and moderate. We were not scared. We were not scared because we had so much of PP that even air couldn't pass in. So that kind of feeling was actually induced into the patient that this is just another kind of fever, and there is nothing to worry about it. And that is what we really practically understood also by managing these mild and moderate cases. That it is nothing to be afraid about.
Now, one more thing I want to add here is, I understand that the nasya as well as the gargling and usage of hot water for all purposes is very helpful. So, are we trying to adopt this in your hospital, or I don't know how the climate in Delhi is? It's a rainy season here.
Swamiji, it is very hot right now.
Taking hot water in Kerala.
Yeah, it is very hot right now in Delhi. It is very hot right now in Delhi. But even we had a biggest challenge. Our hospital was centralized air conditioning. So our director was so specific that we cannot let the patient live in this hot environment. And she installed new separate split ACs inside with separate exhaust so that the patients can remain in a very normal temperature, even though it is hot outside. So the red zone of ours is the most comfortable zone for the patient and a difficult zone for the medical personnel because we are in PP, but for them it is a very manageable temperature which is set inside. I think there are around 22 air conditioners separately set inside the wards just within a gap of 2 days after an inspection that she conducted. And it is very comfortable, and we are using these things for it. Actually,
we were asking about this nasya gargling, which has also been recommended by Ministry of Ayush. So mostly it is having preventive value, but there are also studies saying that if doctors use it, it can prevent, if you give it to a patient. So are such things being tried? I mean, that's just a general question.
I don't know if I'm allowed to. We have the entire All India Institute of Ayurveda is tried with that. every faculty of All India Institute of Ayurveda, there is a study going on. So that study has use of nasya, gargling, everything that is mentioned in the Ayush prophylactic study. So that is the prophylactic clinical research carried out on health workers. So we are the samples. So that has been carried out in us. Other than that, in the hospital, in the asymptomatic cases, we have carried out this. Not on the symptomatic cases. In the asymptomatic cases, we are asking them to do the gargling, nasya. No, because we are waiting for them to just get turned around into negative. That's all.
Okay. So that's good. We got some idea about the treatment. I think the treatment is really, there is a whole spectrum from complete customization to very rigid protocol. And I would like to ask Dr. Pavan, because you have experience both in clinical trial, you also mentioned that you have also been telephonically consulting patients. So there's nothing much to say about the trial because it's only Ayush 64. But when you have to treat a patient, how are you approaching? I mean, are you also using Rasaushadhis? Are you customizing?
Customizing is the thing. That is the greatest advantage of private practice, or you can say practice, uh, personalized practice, better word to use. So each to his own. So whatever is available, phone calls are coming from abroad, USA. You cannot just prescribe them some gruta, which is not available there. But just to very quickly sum up what I found very useful in my practice in COVID-19 patients and their contacts and their families is use of Mansyadivati and Manas Mitra Vatak, and very surprisingly Mahakalyana Ghrita. From the Girija madam's paper, I read about the Vidaryadi Grit. So I prescribed that to one of my patients, of course telephonically, and he didn't get that Vidaryadi Grit. So I just added, I supplemented, instead of Vidaryadi Grit, use Mahakalyana Grit, and very surprising and very good results had come. His family also, to I advise them to take, everybody used to take Mahakalyana Group, and the main complaint was that there is sleeplessness, and that sleeplessness was gone. Another very important thing I add in my prescriptions is that Sansarjan Kram, which I find very useful in the patient. They have actually something to do and to prepare Krit Yush, Akrit Yush. So some target is there, they themselves have to do, and the medications that set what Girija madam's paper has set, Sudarshan Churn. So we converted into Sudarshan and thus other things. So that these are very easily available. Sudarshan Ganvati is available, Talisadi is available. If not Talisadi, then we use Sitopaladi with honey. But that kind of customization is done. But additions, Manas Mitra Vatak, Masyadi Vati, and Mahakalyana Grut. That should be thought of. Prashantji. Mahakalyanic Grut is good for so many other things. So this is my personal experience, and from lab point of view, my main basic dhanda is lab. So laboratory parameters are very interesting. Findings are coming out. People are coming with various hypotheses like LDH, those kind of collections we are doing. So I will be sending you those as a position paper. Let's get your opinion also. But some interesting things are that LDH is raised too much. CRP is raised a lot. And these kind of individual observations are there in 6 or 7 lab reports, apart from RT-PCR.
General patients. Are we getting any non-COVID patients just to prevent or seeking advice from the doctors? How is the scenario in Delhi? Because I think it's Jaipur also.
Youth, sir. The most frightening thing, as Prashantji also said, that it is a manas vikar also. It is not just a physical thing. It is not, but beg to pardon that it is not just a virus. It is a very dangerous virus. It is as big a virus as HIV. So it is almost a death sentence to the person who has got affected with COVID-19, and people are fearing like anything. That maybe I will get, what we call it, terribilizing. So they are terribilizing those events. So we counsel them also. So I have coined a term as terribilizing at one spectrum and trivializing at the other. So people who are roaming around not at all fearing the virus, that there is no such thing, it is a figment of imagination, is also wrong. And terribilizing it, that it is going to finish off my family or me or the world I know, is also very wrong. So taking the middle path, as Vagbhat has said, Sarva Dharmeshu Madhyamam. So Pratipadam, every step, middle step, very pragmatically, we should confront that virus and take all safeguards against it, but not fear it or not get terrorized by it. So terribilizing is also bad and trivializing is also bad. People are coming for that, sir. A lot, huge. Most the Kada, the Sanshamani Vati is flying off our shelves like anything. Even doctor friends, modern medical physicians are asking for Chavanprash and kuch Kada de do. and we are giving that. कुछ ना कुछ तो दे ही रहे. Even रस औषधीज we are giving.
Okay, thank you. So I think we talked about two aspects now: what type of patients are coming, and then what are the treatments given. And I think in both ways we have understood that all types of patients can come to an Ayurvedic physician. I mean, from the clinicians we found, Girija Madam was especially talking about very difficult cases that she had to handle. So it looks like Ayurveda is capable of addressing, the challenges of this pandemic at all levels. Although we generally say we should restrict to only mild and moderate cases, but from this discussion we understand that we can also offer supportive care. Like Dr. Jyoti was also mentioning about so many cases with very low SpO2, where even allopathic doctors did not mind Ayurvedic medicines being given, and the patients also recovered. And it looks like when it comes to clinical practice, I mean, physicians have absolutely seems to be exercising that freedom, choosing where to give rasaushadis, where not to give, all those things. So now we are coming to the last part of this, panel discussion, is how do we make sense of what Ayurveda is doing? Girija Madam already told in the beginning that just because it is self-limiting, we cannot dismiss the outcomes of Ayurveda. But unfortunately, that is what we are facing. I mean, what is it? How can we report? I think this is very, very important, because as the pandemic is still, spreading, we have not yet reached the peak. It's very, very important for us to understand, what to expect out of Ayurveda, what support can be given. And I think this message should go into society, so that more Ayurvedic physicians can be equipped and get the right perspective, which is one of the goals of this panel discussion itself. So how can we, just because we are being questioned by saying that just because a patient gets better, we cannot say it's due to Ayurveda. So what should be the criteria? I mean, I would like to start with Girija Madam. Can we say it's that with Ayurvedic treatment, patients are getting better faster, and we can prevent them from going into severity, which is what Madam pointed out in her paper also? And even in critical cases, do you think, like Dr. Jyoti has also treated such critical cases, do you think Ayurvedic treatment will really prevent the patient from going into a crisis? So we would like to hear from Girija Madam first.
One thing definitely I can say, that the death rate would have been much less had this pandemic has been handled by Ayurvedic systems. Everybody who is going to an allopathic hospital is not walking straight into an ICU. They are staying there for a very long time. They are deteriorating for whatever reason, and then the death is happening. Nobody is going there and dropping dead. The other thing is, there is a lot of intellectual dishonesty going on. All in Tamil Nadu, forget the government hospitals, they are using Kapasura Kudineer. Kapasura Kudineer is nothing but Barangyadi Kashayam plus 3 more ingredients, Tulasi, Karpuravalli and 1 more. So they are giving this Kapasura Kudineer in all hospitals. Private hospitals are also using it. Today patients came to me, they said their friends went to allopathic hospital. They gave only vitamin C, zinc and Kapasura Kudineer. This is in Ramachandra, it's a deemed medical university, I think. And also there is another well-known private hospital in South Madras where upper class people go there. So these hospitals are openly giving kashayams along with whatever they are giving. So I think there are a lot of medical journalists. Not a single person reports any of this. Nobody is reporting. So why are you then giving Ayurvedic medicine also along with whatever you are giving? So if only we should be honest and try and assess what is the situation, how it is being handled, I think we'll get a lot more information. Then about Ayurvedic being effective, there is no doubt about it. Ayurveda is being very effective in handling all kinds of patients, and in that sense, definitely we could have reduced our death rate. Anything else you asked me, Dr. Ram?
it's only like, what parameters we can, suggest to report our, because I think it's very, you have taken a real initiative in publishing the first case report. And I understand you're also working on case series. Dr. Prashant said that he's also working. Dr. Jyoti Joshi is also planning to write out the reports. So I think this will be very crucial to get the message across, because if journalism is not covering it, I mean, Ayurvedic physicians who are at the point of care should themselves report. So what would be your advice on how do we report it? Are you able to collect all the data? Is it time consuming? And what are the challenges you face when you are trying to report the outcomes?
Actually, here, when the first case happened, it was in March. It was Professor Bhushan Patwardhan who told me I should write it in the journal. Then the next time I was treating these patients, it was Dr. Ram Manohar and Dr. Gidish Tillu who told me I should put it down and produce a journal article, otherwise it will only have archival value. So, but it's not difficult to put it together, because since we have followed a structured format in each and every case, it's possible to put it together, look at the data and see what is the possibility. But I tell you one thing, if they talk about placebo, this is the time. You keep a toy ventilator and a toy oxygen cylinder next to our patients, give them only Ayurvedic medicine, however critical, they will overcome that. Because people are running to modern Western hospital, the reason being they think that they are going to deteriorate, and then in the event of deterioration, there is ventilator and oxygen facility available. So every person who gets COVID thinks they are going to deteriorate, and this is the reason why they are making a beeline to these hospitals. But I must say, those under quarantine, it took enormous courage on their part to self-quarantine. 99% of them are all first time coming to Ayurveda. Then we have to on the telephone, they have never met us, on the telephone, hand holding them every day, daily conversation, and then giving them instructions repeatedly about diet, about medicine, and then to monitor themselves, because they are so used to hospitals monitoring them. Some of them say the hospitals would monitor us, all our organs are checked and monitored and every parameter is being looked into. So they find that more satisfying or relieving than somebody who is self-quarantining and self-monitoring and taking our instructions. So it's all a lot of, we also learned a lot from all this. So I think I would try to, our team would try to put it together and publish it in some journal if it is of any use. Because we as practitioners, we always don't think of publishing our work. This is the first time we thought we should.
Yes, I think that will be very useful for the community. Thank you. And I just read yesterday that in Bangalore, 97% of the patients who were on ventilator actually died, and there was no use of, giving any ventilation. Yes. So now I'd like to ask Dr. Jyoti Joshi about how are you assessing whether your treatment works or not? I mean, on what parameters do you think that patients are improving faster? You are able to prevent them from becoming more serious? What do you think is really the benefit of your treatment?
I started my talk with how I started with COVID patient. There were 5 patients. So out of 5 patients, 4 patients took our treatment, like pure Ayurveda treatment, no even paracetamol tablet. And 1 patient, I don't know what is the reason, but he, because of fear, he got admitted in nearest hospital. And he was admitted there for 20 days. And after getting discharged, he again consulted me because he was still on O2 and all other were recovered. So this will be a good comparative study automatically done, because that patient left the treatment time, all other continued our treatment. There's CRP.
All of them approach you at the same time, but only the patient who went to allopathic hospital suffered for a longer time and did not fully recover.
Yes.
That's what.
Yes, yes, sir. And that patient last night only, I've just asked that patient to repeat the CRP. So that patient has CRP more than 22 point something, and all other our CRP levels are below 1, and all other are completely. Their test is negative, but that patient is still on some on and off oxygen support. Now we have started our treatment, and he recovered. And because all other friends are recovered, so that patient has severe anxiety. For that, I just asked him to take Jatamansi and all. So that's why we cannot follow a certain treatment protocol as per patient. We need to add or add or some delete some treatments like medicines. So in this patient, I first of all I need to start because he was worrying that all other friends are negative and I'm the only one who is still suffering. So just give me the medicines and all. I just given him Jatamansi medicated water, that Jatamansi Fanta. Anxiety is bit reduced, and thereafter I started the treatment, and now he's stable, and still CRP is in all like high range. So this is one comparative study in my own clinic. Thereafter, efficacy of Ayurvedic treatment in COVID-19. So as far as I have data and I've treated the treatment. So what is my view about the COVID as per Ayurveda? So I just simply Jwara, Rogarata, and it's all Adhipati of all rogas. And in Vimanstan, if we see it as a Janapadvamsaniya, because it is called as a pandemic. So in that situation also, Jwara is mentioned. Importance of hot water is mentioned. So we are not only giving hot water, we are just giving that Shadanga Paniya. And in Charak Samhita, after Shadanga Paniya is mentioned, and thereafter there is again combination of different Shadanga Paniya contents only, like Duralabha, then Duralabha, Shunti, Guduchi, then Musta, Parpataka. These combinations are there, so I'm just trying all this combination in different patients, and I'm getting results. And the main part, as Swamiji told, patient that it become Manas Roga as well. So counseling, I just try to talk with the patient twice a day, and every 2 hours we take the follow-up. But with each and every patient individually, I have words with I just talk with the patient, and already those patients have seen the results with Ayurveda, so it become easy. Patient have confidence about on like our pathy and our science, so it become easy. Right now we have patient, like I'm working in Mumbai, so we have patient from Hyderabad, then in Maharashtra, different parts of Maharashtra as well. So counseling is very important. Whatever the diet we are suggesting, so giving them just telling them the importance of diet, that is also plays important role. And once the patient CRP is in control, like I'm previously I presented the paper, like you have asked me about the documentation and publication. So yes, I documented each and every case. I have documented the record of patient for every 2 hours, and one case paper is ready under the guidance of Ramano sir. Thank you so much, sir, for your guidance about for encouragement for publishing the paper. So that paper is already ready, but that patient was admitted in government hospital, so some restrictions were there about the blood test and all. But now in home isolation patient also, I'm just giving them treatment, and all the like WHO and ICMR protocols, like D-dimer test, then CRP, then LFT, SGLT, and SGPT is also increased in some patients, and thereafter interleukin 6. So all these parameters also we are monitoring, and these with these blood tests we are actually able to give like our case report in like all other standard way to ICMR people as well, because this is the question, that this is the placebo effect or it is self-limiting disease as well. So with all these blood tests and the videos and audios of the patient, we can prove that this is not the placebo effect actually, because it is working in all the cases, like mild, moderate, and severe cases as well. So I'm documenting each and every case, and we are going to publish one case report as well. So let's hope with all these things we can reach to some conclusion that what Ayurveda can do for COVID.
Thank you. Thank you. Now, Dr. Pooja, you have treated so many patients there, and I would say we are all very eager to see some report coming out of Chaudhary Brahma Prakash, because you said a lot of your patients have already left. So the data would be really very interesting. What efforts are being done to publish that? And
Yeah. Yeah. Yes, as I mentioned earlier, that the overall impression is really very satisfactory, and most of the patients with mild to moderate symptoms have been cured with Ayurvedic intervention only. And like the patients who are, and the success rate, it varies from patient to patient because depends upon the different criterias like their age, comorbidities, and even the stress part also, and the socioeconomic status of the patient as well. So yes, definitely Ayurvedic intervention has proved as preventive as well as the curative modality for this dreadful pandemic. And the patients are, apart from the involvement in the hospital, the patients all together, like even from my society, from everywhere, the allopathic doctors, they are approaching for any suggestion for Ayurvedic intervention for COVID patients who are treating their patients, like in their own hospitals or in their practice. So my firm opinion, my personal opinion is that the integrated model, I think it is the best model to deal with this pandemic, number one. Second, if we talk about the definitive conclusive data in our hospital, we are running almost 5 to 6 projects. Two projects are IMR projects of CCRS. That is, one is Ayush 64 and another one is Chavanprash, and third one, which is the own protocol, which is developed by our own college, and that project is almost complete, and we are very soon coming up with the conclusive data for the publication. With apart from these IMR and EMR project, one project EMR project in which myself I'm the PI. So that is for healthcare workers, and as along with the finding solution for the treatment of COVID-19 cases, I think the protection and prevention for the safety of frontline warriors is of paramount importance. The healthcare workers, including the consultants, the nursing staff, the cleaning staff, and the attendants, they all are prone to this disease, and they are exposed, very much exposed. So for their benefit, we have initiated a clinical trial for healthcare workers, and with the intervention of Nasya, you have mentioned, Anutel Nasya, and along with some other medicines like Madhuyashti and Amlaki Chun. So that has been already, I have submitted that, and I have got clearance from the institute. So another projects with the intervention of yoga, and we are coming up with the conclusive data very soon, and that we are very eager to share with you all. So that is what we are doing for the publication and these activities.
Dr. Prashant, you were mentioning also that you are planning to share your experiences, and I think you especially mentioned about preparing a hospital to manage COVID-19 patients and the challenges, even in wearing the PPE. So maybe you could very briefly mention about this, what you are doing to do the documentation, plus how you are preparing. I think you were involved in setting up that whole COVID ward in AIA.
So basically, I had to volunteer myself to go inside for setting up the ward initially. So I think that was an area which I could actually do some. Do you want me to share the 5 slides which I have prepared, sir?
Yeah, you can quickly share it.
So this is with the guidance of my director, Tanuja madam, who had actually asked me to go inside. It was basically challenge, sir, and we learned certain lessons. So to begin with, as we always know that it's Amma's grace and wishes that always let us move forward. So it was a 40-bed hospital, which was a air-conditioned oxygen facility to make the patient feel better. And we had a holistic approach of management along with yoga, meditation, indoor games, and recreational activities. There was a 24/7 dedicated medical team of experts, sir. It had actually doctors, nursing staff, paramedical staff, including the housekeeping staff and the security staff. It was around 24 people at a time who, as a team, went inside. So I named my team as Team Alpha as we were going inside the beginning, and we created certain landmarks and goals for the future teams to actually follow. We also had the support of emergency medical officer. Also, we had lab assistants and laundry and other staff who were along with us, who were supporting us. We also had actually established the RT-PCR and antigen testing facilities in the hospital. So among the symptoms that we observed, these were the major symptoms that we could see in the patients during our stay in the hospital, from mild, moderate, and asymptomatic cases. And management part, I already told about the guidelines and the things that we could follow, and these were the things that we actually considered for doing it. This is where I wanted to actually focus on. Every hospital, every Ayurveda person, when they're trying to convert their hospital, especially if it's in Amrita, if we want to convert our hospital into a COVID health center, I think it will be soon, because the number of cases are going to increase, because it's very communicable and it's going to come in and around. So once it happens, we need to convert and be ready ourselves to actually be into this setup. So we need a green zone, a red zone, a orange zone, and a separate patient entry and a staff entry area. So, the green zone is an area from where you should actually monitor the entire hospital and monitor the entire facility, including the patient entry exit area and staff entry exit area. So these are actually divided not just with complete blockage. Even when we enter or come out, these are according to ICMR guidelines. Air curtains, red zone consists of the wards, rooms, yoga. Red zone is the area where the patients are there. Green zone is the area where there are medical staff and people who are ready to go. But once you enter the red zone, to come out, you have an orange zone, wherein you need to remove the PPE. We call it donning and doffing. Donning is putting on and doffing is taking it off. So there are certain steps and SOPs which are provided by the ICMR. So all these were new. Everything was new for a Ayurveda doctor to actually follow. But being an NABH hospital, All India Institute was already well established and well facilitated. All we need to do was to move things into place. Based on this, what we learned is that this is me in the photograph with the thumbs up in a PPE. But you can see I didn't put my own photo. After removing the PPE, this is the situation. The sweat is so much that you get so much dehydrated after wearing. So what I did is, when my 24-member team went on going inside and out for 10 days, we calculated an average time in the 4th floor that we have, because we have non-permeable PPE and it's not circulating. So it was very difficult. An average time that I could calculate was around 38 minutes. The people who were wearing it had the complaints approximately about 38 minutes. The complications were fluid loss, constricted mobility, being panicked. If there is an Alpa Sattva or a Madhyama Sattva person going inside, by the time you need to come out, you will not actually follow the doffing instructions of step 1, step 2, how to remove a glove. So we had to actually formulate new SOPs by sending in a doffing buddy, donning buddy to stay along with the person and be very strict with the person to actually remove each and everything one by one, because this is one of the very important area where an infection can come from the patient to the medical staff. And if one of the medical staff is infected, the entire residential team will get infected. So I feel that this is one of the area. These were the customized SOPs we developed, right from snorkeling symbols to spacecraft things. We tried to incorporate everything to make customized SOPs. And in the patient care, the most challenging problem with the hospital was limited approachability and exposure. We should have minimum exposure and maximum care, and the ward visit should be reduced, because sometimes the doctor has to do the housekeeping staff's job and the housekeeping staff has to be elevated until a nursing staff job. So each visit we had to wear this PPE, go inside, see the patients and do it. Diet was another important part, but even in diet we need regular planning. Like, we can only use disposables to customize food delivery and very clean and hygienic way of transporting it. So basically it was like a pre-planned setup wherein we could actually do things inside the ward. And biomedical waste management is also one other important aspect wherein we should actually have a separate passage for going and taking it away. This is housekeeping staff, even he should wear a PPE and go inside, and even laundry should also be using the PPE to actually work on. So I was talking 2 days back to Ramano sir, and I was telling, so when I watched the movie Contagion, they had a PPE 2011 based movie. They had a PPE which has an air circulation, but these PPEs are like raincoats, like our rice bags. The plastic which is made of making the rice bag, it's the same thing with Vicryl and zips. With the glasses and double mask and gloves, you will be absolutely feeling very complicated and very uneasy to do the regular kind of work. We even try to enter data electronically using a tablet or mobile instead, but even that was really difficult. So our basic observation is like only teamwork of healthcare workers can actually help Ayurveda or any system to actually come out of the entire thing. Ayurveda treatment gave encouraging and promising early response and compliance. And I think we can actually study about the reduced hospital stay and the post-COVID quality of life improvement with this Ayurveda. I think that will be really interesting to look into that aspects. And patient involvement in indoor activities, like we regularly conducted yoga, pranayama, guided meditation. There was a mic and telephone system, so we let them have a time wherein they can actually ask us to play the songs which they love. We have a video conferencing system from the wards wherein it was like, we actually visited all the hospitals around in Delhi, which was dealing with COVID patients, and try to actually find out the loopholes and bring in the positivity into All India Institute of Ayurveda so that things are much more smoother and better. So as of now, it is going on well, sir. I personally felt that this positional adjustment right from the beginning itself is really helping in the shortness of breath and breathlessness, etc. And Vasa and Guduchi, Swarasa Prayoga, etc. was really found to be helpful. And what I want to concisely tell is that, sir, as Girija Madam told, it is really wonderful if you actually keep oxygen. We have a central oxygen connectivity, oxygen mask next to the patient, and ventilator, and give the Ayurveda medicines and convince them and make their mind, like do a saptahoja to change their mind from the fact that they are going through COVID. As Amma always told about COVID, courage is our mind's antivirus. The best antivirus what we have is we should inculcate is the courage, and I'm sure that together we can be and we can change this situation, and it will sooner change with the interference of Ayurveda. And based on Kerala, I feel we cannot actually blame the government. Even today, I heard a report from Chief Minister telling that if you want to save your life, be with allopathy. Because the situation is so that they have to listen to the modern medicine practitioners because they controlled it very well till date. But from now on, it's going out of the hands, and that's where we need to be really ready and come into practice. I know that I was very fast, but I hope I could convey the point. Thank you.
Yeah, thank you. Yeah, it's basically because when we discussed, thought that this preparation is very important. Looking at what you said, it doesn't sound that this virus is so simple after all, because in terms of the preparation that has to be taken by the healthcare workers, it's really quite challenging. So thank you very much. Now coming to Dr. Pavan, I would like to hear from you. What are the efforts being taken for the publication? At the end of the day, now it's quite clear that Ayurveda doctors, a practice institution, trials, we are dealing with COVID-19, and I think data will make a big difference, because in states like Kerala and many places where there is resistance, if more and more data comes from people who are actually treating, I think that will play a very big role in making Ayurveda available to people who may definitely be benefited. That's what we have understood. So what are your thoughts and what efforts are going on?
NI is right now involved in 4 major projects. One of them was as soon as this COVID-19 started. So before the task force was set up or anything else, so we had to respond. So what we did was we prepared a immune booster kit of our own, that is NI immune booster kit, comprising of Chyawanprash, one immune booster capsule, immune booster kadha, and some consultations, and we gave it to more than 4,500 high risk group people, police officers, health workers, and all those. So that data is already with us, and after cleaning that data, we have say about more than 1,000 data from 1,000 people, which is already ready for publication. 3 drafts have already been resent, that process, and 3rd draft has recently gone for publication. Let's see how it turns out. Then remaining 2 papers, that community based study for 12,000 sample, n is equal to 12,000, is on, and we are waiting for say first week of September for the study to end. by 20th September, we will be ready with the first draft of the paper. And,
Okay.
and then the AIM study is also supposed to end in a good publication by mid-September. So publication, we know that it is such a big passion of Ram that whatever is to be done has to be documented, and whatever has to be documented has to be nicely written and presented. That is a good thing to be done. It is a thing to be learnt by all Ayurvedic community. Just doing is not doing at all. You have to document it also. So if you do, show it. So the motto of Ram, we bow to him. He is such a legend in publication field. So other people are also there, I presume, Geeta ji and Girish Tillu. So legends from publication world. But it is high time that Ayurveda learns to publish whatever it is doing. So NI is doing its bit. Let's see how it works out. So we are expecting 1 or 2 papers soon.
Yes, Prashant, we have to really now move on to the discussions.
So just to add the point that I missed, I'm sure that detail will be given by the Director of Indian Institute of Ayurveda. Based on the cases that we were dealing here, we are actually planning to publish a case series on that which you have mentioned. Other than that, what I have mentioned in the slides, sir. So the SOPs, the opportunities and the challenges and the opportunities that we learned from it. So that is also documented and going to be published as per the advice of our advisor Manoj Nesri, sir. So that is also going to be documented from All India Institute of Ayurveda. Other than that, there is a bunch of publications going to come from. I hope Pawan sir is very much aware. A lot of too much of work is happening on behalf of COVID. Geeta sir is also very much aware about it. So I think Tanuja madam will detail about it.
So I would like to thank all the panelists for a very engaging discussion, and please excuse me, pardon me if I was not fair enough or had to interrupt in between. There is a limitation, especially when it's an online panel. But I think this was quite enlightening and insightful, and hopefully we can continue the discussion. Now we would like to move on to the discussants, and here their comments on what was discussed so far. So I would like to request Tanuja madam to open up the discussion, with the participation of the discussants. And again, we have very short time, so it would be great if everybody can, very brief, and then just convey the most important points that they think should be discussed in this forum. So over to Tanuja madam. Welcome.
Yeah, thank you. It was really heartening to know the success stories of all the youngsters, the panelists, and I congratulate each one of them. Her experience was really great. Dr. Girija, Dr. Jyoti, Dr. Pooja from CBPAX, and Dr. Prashant. And thank you, Swamiji and Dr. Ram, and the other members for initiating such a important discussion from the Amrita school and providing this platform. With all this note, and Dr. Pawan, his research experience and NI experience is also heartening to note. I would like to share what All India Institute is doing since last 4 months. And the first thing, apart from, before we just moved on to clinical, that is a CHC, COVID Health Center. But the first one largest cohort study I would like to share here is we have given the preventive kit in the name of Ayu Raksha, which includes Sanshamani Vati, Chavanprash, the decoction Kadha, which is notified by Ministry of Ayush, and Nasya, nasal administration, to the police personnel, because who are the frontline COVID warriors, because they are on the road. So we consider this as a biomass, and this number is not 8,000, but it is 80,000. So this is the 80,000 police personnel. For last 2 months, we are closely following. We have already distributed, and with the scientific rigor, where we have roped in Public Health Foundation of India to capture the data with their immune status questionnaire. And to a small subset of the entire 80,000, we are also assessing their lab parameters. What is the, because the main prophylaxis study was to boost up their immunity so they do not get infected, and when they become the positive, that means prophylaxis is ended, the medicine has no effect. But to our surprise, and to it is an exciting note that when I was not here, before 2 minutes only, I got a call from police commissioner's office that after the 60 days of giving the Ayurveda kit, that is a preventive medicine, the number of police personnel, that is a daily report. So in daily report, if every day it was 67 per day, Delhi police out of 80,000, now it has gone down to 18. So that the graph has gone down significantly. And the number of cases, even though in the entire Delhi and in India it is 23,000, but compared to other active cases, the percentage of the active and getting infected is comparatively very, very low in Delhi police. So that is the what we can say indirect inference, but we have on the COVID dashboard, and we have with the scientific rigor, we have closely monitored each and everyone's immune status questionnaire. That's the success story because of the Ayurveda, but because of the our committed entire team of All India Institute with the committed team and with the support of the ministry, we could manage this. And now it is a time of data management and analysis with the statistical analysis. This is the one success story with the Ayurveda kit. That's what I wanted to share with all expert panelists. And now coming to the COVID Health Center, as my colleague Dr. Prashant, he has already shared many success stories. But as an administrator, I would like to share here, because Swamiji is also sitting, and that may inspire many others also, that our entire setup, especially all the hospital setup, is setup which is made up of to cater the non-communicable diseases. But from shifting, once we accepted to be a part of the COVID Health Center, so from shifting to non-communicable to cater the communicable disease, that itself was a big challenge. That's what I wanted to share, because we need to have a very robust mechanism for infection control committee, biomedical waste management committee, and to make entire hospital into red zone, orange zone, green zone, and to have everyone, because more important also is the safety of our frontline warrior, our hospital staff, and the patient who are non-COVID patients, their safety is also very important. So and one thing which I would like to share with proud, and with a great pride I take this, because many hospitals who have turned into COVID hospitals, they have shut down their OPD services, and they had to shut down, and their IPD services. But this is the only hospital, even during the lockdown and during the curfew time, also we have not closed down a single day our OPD services. We are doing the treatment for our non-COVID patients also, and one ward is dedicated to COVID patients. So this is one thing. And we have 510 staff altogether, AI, All India Institute family. And what we did for ourselves, for the safety of our own Ayurveda, because that was the one which was the concern, that when we started the COVID treatment, so there was a lot of phobia even amongst the staff of our own hospital when we will admit the patient. So initially there was a lot of inertia, like inertia, and no one really was ready to be a part of the COVID hospital, COVID part. But slowly, when this journey started, what we did first to ensure the safety our own, so we have started, as Prashant shared, that we have started taking preventive kit our own self. Everyone, starting from our housekeeping to the attendant, to the security, to the technician, postgraduate scholars, nursing staff, the capacity building is very, very important. Extremely important. It is, we have already taken the, we are taking, I am also taking, I have everything on my table and everyone is taking. So that preventive kit has really given us the great confidence that we will not become infected. No one will be infected, number one. And secondly, since we have not stopped treating anyone, so maybe what we say that we might have become positive and now become negative because I have got a confidence that I am not get infected, and not me. All our doctors, seniors, medical superintendent, we are working here. So maybe there is an everyday exposure and that herd immunity, that antibodies have been created, I don't know. But because of the strength of Ayurveda and because of the team spirit, we are working with the great confidence. So this is one thing I would like to say. And the lastly, because of the what is the experience of the COVID treatment and what is the difference between the conventional medicine and the Ayurveda hospital management. That's from the management part I would like to say. I was just, we as a teacher and as an advocate of Ayurveda, we say that from treatment, from illness to wellness, we give from illness to wellness. But as Ayurveda is a knowledge of healthy and happy life, so what we could practically see here that we could give happiness also. It is from journey from illness to wellness and happiness. Because Prashant might not have been discussed in detail, but we have as a holistic protocol, we have created and we are now hoping and aiming to create a standard treatment protocol where it includes diet, includes yoga, it includes shodhana, nasya, oral medication, but also it includes recreation. We have 1 hour in the evening. It's reserved and dedicated to the patient's own participation. There, we have a program called as Man Ki Baat, where they share through the distance audio visual. They share. It is a Aapka Manpasand Gana. So we just run the Gana for them. They start dancing. So it is a recreation facility. So the testimonials what patient has given, and that's the human touch we give here in this hospital. So those patients, the testimonial what they have told us that there was a suicidal ideation because lot of stigma. The patient comes in with lot of stigma, fear, and the anxiety and depression. So with this familiar environment, because are all 27 people, it is a team of the cook, laundry service, and also pantry, canteen service, and the staff, everyone, they stay 24/7 for 7 days, same team. So they said that it is a new family what we have got here, and they are not ready to get discharged, and they go happily. So that they say that you have given us the family, you have given us the happiness, and you have returned us our own life. You have given us our life. So that is the testimonial they give us. So this is one important thing I would like to add, that if we really tell them it is not yet tagda prove hai, and we just provide them all the services. I think this is from the patient perspective. And lastly, I just stop here by adding one from the student perspective, because this is a teaching hospital. We have got postgraduate students, and all the top meritorious students, they get admission because the topper, Charu, and the others, they got the admission from AIPGT. And she was the part of the second COVID team. And what we do, just going and outgoing and incoming team, we have the interaction session with all the hospitals. We welcome them as a COVID warrior, and we just listen to their challenges and their stories. So one Charu, postgraduate scholar, she told me, she shared with all of us that she had taken the admission to this hospital, to this institution because it is a tertiary care Ayurveda hospital, and they wanted to see some emergency management standalone with Ayurvedic protocol. And what they could see, what she is told that for last 2 months, 2 years, what I could not, I could see some success stories on OPD basis, success stories on IPD basis, but I was not able to see and witness the challenging and tertiary care emergency management in Ayurveda. That I could see, and that small corona has given me the opportunity. That's the words of their who was tertiary care, our postgraduate scholar, and what they did. I just asked, what did you do? So they said that even we have that oxygen line, that is a gas manifold. So it is a oxygen therapy. They know how to wear donning, doffing, and everything they know now. They have learned, but they have learned emergency management through Ayurveda. So one case story I will just share here. 106 temperature, and that day the referral was not possible, and they had just decided and made their mind. All our entire uh, uh, the entire team had decided to manage with Ayurveda. So what they do with Sudarshan Ghanavati and some herbo mineral preparation, they could really get rid, and the temperature was relieved, all the symptoms were relieved. So with oxygen therapy and the Ayurveda management, tertiary care is possible. That's the confidence our students got. I think this is the success what I achieve, I consider in terms of the COVID management. And what is expected, because we are just recording all our success stories as a case series. We have decided to come out with the case series, and that is a next our IU care will be dedicated to the COVID-19, and that publication would come from AIA, and to share that we are a part of nine clinical studies, major clinical studies conducted under the Ministry of Ayush and the sponsors and many IITs, IGAB, ILBS, and many AIMS. So we are conducting as with the scientific rigor under the task force also. So maybe shortly we'll come out with the good notion. But again, I think there is a strength in Ayurveda, and as Madam Girija told, that अगर हम आयुर्वेद से ही अगर प्रोफिलैक्सिस एंड ट्रीटमेंट करें, practitioners guidelines को follow करें, so there is a lot of strength, and all these azithromycin and others are really not required. Gita Krishnan, he is also witnessing that if we ask to our global partners, see what is the standard of care to compare. So they say there is no standard of care. Standard of care is a no medicine. And we here in India, unfortunately, we are using all HCQ and azathioprine and ramipril and others. So now this is the first, and those are within this 200 years. This is the opportunity we have got, that there is a no standard of care, and Ayurveda I think is a standard of care maybe for tomorrow. So with all best compliments to all the young budding stars which I see as a panelist. So all my congratulations and compliments, and I just want to clap them for their success and their dedication. And with this, I once again thank Dr. Ram Manohar and the Swamiji for giving this opportunity. Thank you.
Thank you, Madam, for the very detailed and insightful, thoughts. Just wanted to ask casually, are you using this dhupam also for sanitization?
Yes. I just missed to say that, like we started giving kadha to everyone. It is not only preventive kit, but whosoever enters to this hospital, we give them kashaya kadha. And similarly, every day we give them the we conduct the dhupana in the hospital. It is a herbal fumigation, and that dhupana, that fumigation, that is called as havana. So we do havana in entire hospital. And when the patients see, our students see that in the COVID ward, when medical superintendent, director, faculty, and everyone is sitting together and performs havan every day, which is really circulated to each and every corner of the hospital and academic and admin ward. So that's the confidence everyone gets that they will also not get infected. So this is what we are doing, the havana, and we are planning to scientifically study what is the pre and post air quality after havana. That is also in the pipeline. Thank you.
Yeah, is it being done in other places also? In like Chaudhary Brahma Prakash, are you also doing this dhupana in NIA? NIA, of course, you are doing outside. Yeah.
Yes, yes, we are doing. We are doing the same thing here also. Yes, since very beginning we are doing.
Thank you. So I think now, since we are also getting delayed, we would like to move on to the next discussion. I would like to invite Dr. Geeta Krishnan, and who's with the WHO. And I think when the pandemic set in, he was in India and he's still here. And he has been taking a lot of effort, especially from behind the scenes. He has been prompting a lot of people. I was also caught one day at the very early beginning. I couldn't sleep many nights because he wanted this paperwork to be done. And so I think we'd like to hear from him because he has been he's been involved in so many wide kind of initiatives, not from the front, but behind. So from
I
a
just
global plan, yes, madam.
I just would like to add, Dr. Ram, he's not doing from behind, he's doing from the front also. That's just I wanted to add.
But more from behind. So a lot of things that he's doing is not visible outside. So from a global pandemic situation, I mean, we would like to hear from you what your thoughts are on what we discussed today, and how do you think Ayurveda can actually be brought into the forefront? I mean, not only in India but also at a global level.
Namaskar, Swamiji, and thanks, Dr. Ram, and namaste to everyone, including Madam Tanuja Nasari, for giving me this opportunity. This is really good. In fact, it was a wonderful opportunity to have heard the real life experience of these wonderful clinicians across the country, and also what is happening in the institutions across the country, in research, in clinical practice, in management of COVID, etc. I think we have, as all of us have identified, that this is an excellent opportunity for us to prove ourselves in the area of a communicable disease, and especially so at a very which can grow into pandemic proportions. So this is true, and this can be noticed by the world. I don't know whether to wish that whether I should wish that the pandemic exists so long that we are able to prove it, or I should wish that we are able to prove it much before everyone else starts noticing it. Like it is quite a confusing decision to make a wish. But still, I think there is a lot of road for us to move before we get a real recognition as a clinical system which will be approved or accepted within the community. This is not only evidence of science. It is not only social issues, or it is not only the problem of Ayurvedic community's inability or ability to communicate. It is a broad spectrum which involves many things, which starts, let us say, the least not the least is the issues which relates to social, the hegemony of the modern medical system, like which is actually sitting over and ruling over the necessities and the needs of the society, as if that is the only one answer which can take care of any kind of medical emergency. So this is something which we have to work over a very broad spectrum, and these kind of activities, which are wonderful work which is being done by Dr. Girija and Dr. Jyoti and Dr. Pavan, and with the entire All-India Institute of Ayurveda and the Chaudhary Brahma Prakash Institute, gives us a stepping stone towards reaching that goal. And like probably over a period of time, we might be able to convince the policymakers that Ayurveda needs to be considered as a standalone treatment procedure In fact, one of the Dr. Girija is quite well known to Dr. Rama Jayasundar, and Dr. Rama has created, along with other colleagues within the task force, a program for like independent management of COVID disease very early in the phase. I think it was in the early phase of the first week of May or something, which it was published, or rather, was submitted to the government. At that time, also, I told her that it might be some time before we will be able to achieve this. But I think we are right now in a situation where we can, because if you look at the whole picture, we have been able to, or the entire world is now convinced that the vaccine is the only kind of option, which is a farce, which is not true, because vaccine might be an option, but you have to just imagine the kind of logistics that is required to distribute it among the people. Just imagine only the country like India with 1.4 billion people existing here. 60% of the people have to be vaccinated to have any kind of effective herd immunity. 60% of our people is 800 million people. You imagine that we are able to vaccinate 1 million people per day in the country. It is going to take us 800 days, which is more than 2 years. By the time the disease is gone on its own, we don't have to give a vaccine. So, like, what are we talking about? We have to find a way of treating this, and we have something in our hand. And we are proving in several occasions and several situations, like in prophylactic cases, which includes more than 100,000 people, like even All India Institute of Ayurveda alone is doing more than 80,000 people. I know about CCRAS, CCRUM, and CCRS taking about another 50 to 60,000 people each. Put together, we have more than 300,000 people being looked at for a prophylactic effect of Ayurvedic therapeutics with excellent results. Like, we are talking about people who are really in the forefront of COVID management, not getting COVID symptoms, and never having a requirement to go for a COVID a test. Even if they are going, most of them are coming out negative. What Dr. Tanuja had said, the number of people getting negative, or rather getting positive, is much less in the Delhi police itself in the past 2 months. So there are a lot of evidence which is coming out. Like, we have come out with clinical trials. As Ram is also involved in one of the clinical trials which we are doing in one of the hospitals in Delhi, and we have completed the trial, and we have completed 60 patients. We know that the number of days which takes for the patients to become negative is much lesser than those patients who were not in the control group. So, but we are still working on the data, and it soon should be out. So there are different options. I think that it is a situation where everyone should do what they can. Some of us would be able to do high-end clinical research, which includes an RCT. Some of us are able to do a very high-end and very well documented clinical practice. And this is a combination of which, unfortunately, in our living history, in the past 2 generations, we don't have such an experience to ask anybody, how do we manage this? There is nobody there. Like, we only have experience of something which is 100 years before, and those people who are alive now has no experience of having managed that disease at this particular moment. So we have no way of understanding how to do it. We have to find it on our own. And the way in which the disease is spreading is also very different, because in 1920, when this happened, it was slower. It was not slower because of the I don't think that it was the virus was less virulent, but because the number of people traveling around was much less at that time. So there is a lot of things which we have to do, and I would suggest that we shouldn't drop our guard in any single area. We should try to approach the government and the higher authorities with all our force, using every single resource that we have. And we have to remember, if we don't do it in India, it is never going to happen outside India. This is the first thing that we have to learn. If traditional Chinese medicine is going to be accepted outside traditional Chinese medicine, China, it is because China, first of all, adopts it. China makes a statement that Chinese medicine is being used for 95% of the people for management of COVID. When is the Indian government going to do that? That is what is going to change the table, because I understand from looking at different data from different parts of the world, never in, even Ram will also agree with me, that not a single Chinese medical journal has yet published a data suggesting that they will be able to make a negative report out of a positive COVID positive patient in less than 7 days. We have several such situations which is going to come out very soon. When are we going to do it? That makes a whole difference. Now, when is the country as a whole going to accept Ayurveda as the line of treatment for the first phase of COVID management? And that is how Ayurveda and how is Ayurveda going to be integrated into the system. We need to put a lot of effort into it. I am very, very happy to tell you that the Secretary of Ayush Ministry is putting all his effort to behind this, and I hope that and I pray that he becomes successful, and we should all pray that he becomes successful, because there lies the success of all of us and our system. Thank you so much.
Thank you very much, Dr. Geeta, for bringing that perspective. As you rightly said, this has to be, from the governmental level, we have to really recognize that Ayurveda is the way forward. And I hope, with all these efforts, we can reach there soon. I would like to now invite Dr. P.M. Unnikrishnan. I mean, he has a very interesting background, based in Ayurveda, in anthropology, in public health. He's with the United Nations University, and I've been closely watching also this whole scenario. So I would like you to now share your views on, what are the challenges in bringing Ayurveda into the public health scenario, and especially with respect to COVID-19.
Thank you. Namaste, Swamiji. Thank you, Dr. Ram. I think, as previous speakers said, we are in a very, very milestone, critical stage. Especially, I think, because after the pandemic started, I think the Ayurvedic community has had great exposure to the public health approaches, public health perspectives, and theoretical ideas, and so on. So I think this has changed the medicalized world of Ayurveda into a more public health driven kind of an approach. And what is most also interesting is when this pandemic started, I mean, it happened in Kerala in January, then slowly started spreading. And initially, if you look at all the articles which was written by end of February and early March and mid-March, you will see that there was always a kind of call for Ayurvedic people, Ayurvedic physicians to be exposed to, getting exposure to hospital settings or having clinical exposure with the patients and so on. But I think towards mid-May, if you look at, till between March and May, the situation was that we were using more the terms like prophylaxis, mitigation, health promotion, immunomodulation, and so on. But by mid-May, you can see already Ayurvedic people are treating patients, and there are through phone calls and so on. And after the lockdown was released in many states, I think more and more people being approached by patients. And so you can see that from the Swastha Vritta, I think slowly Ayurveda is entering the Athara Vritta. But I think there is a thin line between who's Swastha and who's Athara, because I think the COVID test, as the PCR test, is what is making somebody Athara, but large population within the positive cases are still belonging to kind of Swastha symptomatic category. I think so. We need to clearly make certain definitions of the epidemiological pattern of COVID. From Ayurvedic perspective, this is same in other communicable diseases like an early HIV infection or a person with carrying malaria parasite in the body for a long time. Can he or she be called as a patient, or is it that we need to have our own definitions of who's Swastha and who's an Athara? So that's my first point. Second is, I think, as Swamiji rightly mentioned, the Ayurvedic community has gone far by, firstly giving this element of care, which is, I think, most important in a public health practice. And one of the patients, I also got a couple of calls from people for getting support, and after somebody was relieved and became negative, I asked that person, "Why did you call me?" He said that the kind of consolation that I got by making a phone call to another person, another system, another perspective on the thing is quite revealing. So I think the care element is very important. All the previous speakers mentioned about this. And I think one danger, especially in such pandemics or epidemics, breakouts, outbreaks, and so on, is the tendency to medicalize the whole situation. So people start claiming we have protocols or we have medicines, single medicines, and so on. And that's a very dangerous situation, especially in a pandemic situation. And as we are working for these magic bullets, I think we should be very aware that Ayurveda has a much broader, non-medicalized, even non-institutionalized. That's very critical, because from Dr. Girija's experience on, we can see that how holistically, how customized way people are trying to manage this. So I think we need to be conscious about not medicalizing the situation by saying that we have drug for that or something. So we need to continue our thing in a non-medicalized, non-institutionalized thing. That's my third observation. The thing is that I feel that we have missed certain similar situations in epidemics like chikungunya or dengue, which already Ayurvedic people have treated. But I think that opportunity was lost. And those became anecdotes because we did not do clear documentation. So I think, as Ram was mentioning, that documentation is very critical, because when Ram said Dr. Jyoti is doing so much of experience, and I saw Dr. Girija's first paper, I thought it was such a wonderful initiative to come out with whatever is there to be in the public domain, not to lose such a positive situation for an Ayurvedic person to be involved in the public health thing. So when I wrote an article in March, end of March, I titled it as Ayurvedic Doctors at the Borders of Public Health. This has been happening for 100 years, as Dr. Gita Krishnan mentioned. The hegemony that is there, the power that is being suppressing us, that's been happening for several years, and we kept writing about all of this. But I think we somewhere we'll be able to break these barriers and go beyond those borders and intervene in this. And I think we have now coming to certain epidemiological aspects that we need to be extremely conscious and start documenting is. One is, I think Dr. Jyoti mentioned a very, very important thing, because she also mentioned about certain failures of, or not failures, but I think some places where there needs to be some outside intervention. And I think these odds are really revealing something. So we need to clearly document. Maybe it's the prakriti of a patient, or it's the ahara of a patient, or a particular desha kala, whatever it is. But I think from an epidemiological point of view, it's very important to understand who's a patient who can go into a critical stage. So if from the Ayurvedic community, if we have some very clear documentation of who can go into a critical stage, and we can have several normative documentation, but what will be very interesting is these odds and these kinds of experiences where we are in a way slightly missing control. It's in a liminal stage, or a kind of marginal stage where we are trying to get back that control. So if we are able to epidemiologically explain those situations, I think that will be very important. The next point that I want to, from an epidemiological point of view, which will be very important, is that now there are reports across the world. Yesterday there was a Dutch study that Ram forwarded to me that long-term complications are becoming a big matter of concern across the world. So I think when the patient is negative, we can still not call that patient as negative. Those became positive could have long-term complications. So if Ayurveda can also develop an understanding of who are these people who are developing, fluctuation in blood pressure, or certain bleeding problems, or certain other complications of organ damage and so on. So if we have a clear documentation on this second aspect, that will also be very critical. And lastly, I would say that I think we are now happy to get a very strong public health community. Lots of Ayush people have done public health, but they never return to public health domain. They just go into the mainstream medicine and do epidemiology or biostatistics and so on. But I think with the COVID pandemic, one positive development is that we are likely to get a very strong public health community within Ayurveda. And from Siddha community, we already know Dr. Girija would know, people from NIE is working, people from the Institute and Amajikare, they are working. So I think that public health community is very, very important. So I think, I have a couple of points more to say, but I think the time is running out, so I'll just stop. But it will be very interesting to look at our failures also, and what are these really epidemiological patterns that are leading to complications and long-term, what we call as ubadravas and udarkas. That would be very critical. And I'm ready. I'm really ready to engage with this community on a long-term basis to ascertain some of these points as well. Thank you very much.
Thank you very much, Dr. Uni, for sharing your thoughts. You brought so many important points in your discussion related to the application of Ayurveda in public health, documentation, and all that. So I would like to now invite Dr. James Chaku, who is a professor of Kaya Chikitsa at Amrita School of Ayurveda. And although in Kerala we have not yet had an opportunity to really deal with COVID-19 patients, Dr. James is involved still with the hospital. We are trying to run the hospital in this COVID pandemic situation, and maybe also look forward to dealing with real COVID-19 patients. Hopefully we won't have to, but we don't know. So we would like to hear from you how you look at this situation, and what are your reflections on what was discussed by the panelists and the discussants so far.
Thank you, Ramana sir. Most respected Swamiji and other scientific speakers. Actually, I am really happy and excited to hear that some excellent works are going around the country in clinics as well as the national institutes. Let this be an eye-opener for the local bodies and the state government, because even after an escalation of 10,000 patients in Kerala, the local Ayurvedic doctors are not even given opportunity to interact or to treat the COVID patients. I was keenly hearing Dr. Girija madam, who also recruited patients with complications and comorbidities. Also, Pavan sir and Jyoti madam gave comments on the treatment in the clinical level, OP level treatments. We also had an opportunity to interact with the doctors of the national institutes, where the treatment was protocol based and guideline based. So, and all them had a good outcomes. So I think we should sum up the outcomes of the institution level and the OP clinical level and come up with some definite protocols, because protocols are equally important, because it helps us to correctly identify the patient which require a standalone treatment, or which require a Ayurveda and integration, or which require referrals. So we should come out with a definite protocol, and that protocol should follow an algorithm. I say this because if a correct algorithm is prepared, then that algorithm can be very useful for the practicing doctors, because all these doctors who talk today gave personalized or customized treatments. So if we can prepare a correct algorithm, and if it can be published, it can be utilized by many young doctors who are interested in practicing for the COVID-19 cases. The most important challenge in developing a common protocol is that identifying the correct case is a big challenge, because all patients may not get fit into the Ayurveda standalone treatment. So some patient may require an integrative methodology to be adopted along with Ayurveda, and some patient will be very difficult to be managed with. Even with integration, they should be referred to the higher center. So a correct, definite identification of such patients is very important in successfully treating COVID. The second main challenge is the infrastructure, because the specialty of the COVID-19 is that even a mild case can suddenly change its clinical spectrum and go into complication. We think that it may be mild, but within hours or within days, it may directly change its clinical spectrum and go into complication. They may require an additional oxygen supply, or or sometimes they may require life supporting equipment. They may require some other things. So for treating COVID, we should always have a good infrastructure. With we can say that we should also have a minor or a small ICU. Then only we can successfully complete, or we can give successful treatment to the COVID patients. Though in Kerala, we are not being given a direct opportunity to treat COVID patient. The other side of the coin, that is Prakriti Vighata, or methods of boosting immunity and Nidana Parivarjana, removing the pathogens by dhupana, by sanitizing and other things are nicely practiced in Kerala, especially in Amrita also. We practice the concept of Prakriti Vighata, that is boosting the immunity of the patient, as well as we supply these things or these medications to the staffs and other patients who regularly visit our college. Thank you, Ramana sir.
Thank you very much for interesting perspectives and emphasizing the need for protocol. I think these things are under development, and more inputs from practitioners can actually refine and develop existing protocols and guidelines. And I think that is what is needed in this scenario, because we cannot be stuck with one protocol which was created at the beginning of the pandemic. It needs to be dynamically evolving. And I hope that through interactions and sharing of experiences, we'll have more and more robust frameworks. Now, I'd like to invite Professor Anantaram Sharma. He's heading the Panchakarma department here and also facing challenges in dealing with COVID-19 patients, because, you know, handling patients from the Panchakarma department at this time has its own challenges. Dr. Sharma is also planning some studies on effects of Vamana Karma in immune boosting, which will have relevance to, you know, prevention of COVID-19. So I would like to now hear from him his thoughts and reflections, you know, on the panel discussion that that we engaged in so far.
Dhanantari Namaha, Namaste to all. So it's indeed very interesting while listening all the experts from various parts of the country, and seniors and all the contemporary Vaidyas from different parts of the country. And I also had, many of you might have come across treating corona or COVID positive patients, not in a hospital setup or in a clinic, or mainly through the telephonic conversations or teleconsultation. So I also had some opportunity to treat or give some prescription through online for some of my friends, or patient references like that. Around 10-15 cases like that, I given some telephonic consultation. And in that, mainly what I found that three type of patients are coming. One, my neighbor is having corona and I want some immunity boosting or some preventive medicines. Such kind of patients are coming. And another is I'm having identified as corona positive, and I want some medications. And then later, last week I was identified as corona positive, and now it is found negative, but still I am having some discomforts, body pain or some weakness like that. So I think we need to address these three stages also. Not only prevention, not only the treatment, also we have to see how to strengthen the patient after the attack of the corona positive treatment. Okay, so the Jwara Chikitsa itself is it's like an ocean in Ayurveda. So we very rarely give much concentration to the actual principles of Jwara Chikitsa. So if you consider the Jwara Chikitsa for the treatment of the corona or the COVID, that itself is sufficient to treat the various conditions of this COVID. So the doshanugatatva, different dosha involvement in the various stages of disease, and the dhatugatatva, all these things we need to consider while we develop guidelines for treatment of corona. And again, the Koshtakatatva of the dosha, when the koshtas are in Shaka, how they are exhibited, all these things need to be considered. And at what avastha we have to intervene, what kind of intervention should be involved, because chikitsaya pradhanam avasthanu vidhanam. The avastha of the disease also very important, in which avastha we have to give pachana ushadi, in which avastha upavasa should be given, in which avastha the shodhana have its own importance. And I'm very much happy that Dr. Jyoti, she mentioned that initial 3 days she only gives the pachaniya kashayas like shadangapaniya and all. That is very interesting, because whenever a patient comes with jara, we directly jump into any different kind of medications. That's not good actually. The Ushna Jalapana, Upavasa, Langana, all these things should be practiced along with the proper planning in the diet. So Pavan sir mentioned, he gave importance to the Samsarjana Krama, because Sarvakarmasu Ayam Praya Vyadi Kshineshu Chakrama. Because this Samsarjana Krama, following the Samsarjana Krama, is applicable in all the stages of these Jara Chikitsa or in the treatment of the COVID virus. Because for the preventive, because to prevent any of the digestion related problems, we can have the Samsarjana Krama. During the treatment of the coronavirus, we can have the Samsarjana Krama. And Vyadikshineshu Chakrama, even for the Vyadikshina also, the Samsarjana Krama have its own importance. So that is why all these things should be considered. And my opinion is that, as I mentioned, Jara Chikitsa itself is an ocean, and there are a lot of principles are to be understood. Instead of jumping into a medicine, because in some Rasa Ushadi text it's told that Langanadi Kramam Hitva Bitva Ushna Jalavajanam Rujadita Janam Vaidyam Rasena Samupachare. So like that, some versions also there, because we need not to follow the Langanadi Krama and all, directly jump into the medication of Rasa Ushadi. Because I also sometimes indicate the Rasa Ushadi like Lakshmi Vilasaras or Vitumaran, etc. also. But still, the Jara Chikitsa principle should be given very much importance. So that is why what I feel is, instead of going for a protocol based treatment, we should develop a treatment algorithm based on the Jara Chikitsa compiled from various textbooks. This treatment algorithm should be properly validated with the help of experts from various parts of the country, and that should be implemented. Actually, in 2008 or 9, when Dr. Santosh sir, who was in the Samhita department in our hospital, we had some discussions, because while he was teaching the Jara Chikitsa to his students, I used to interact with him. So we had some discussions, and we were discussing that we should develop a algorithm of this treatment, from which part we have to go to the next stage of the treatment and what treatments can be implemented. I think these treatment algorithms plays very important role, because this gives freedom to the Vaidya, and also we can have a lot of various practices based on the Jara Chikitsa. If you concentrate on developing a protocol, a single protocol, that will limit the thought process of the practitioners, and we will be limiting to a nutshell. So that's why I think that a validated Jara Chikitsa treatment protocol is very essential for treating not only coronavirus, whatever viral fevers or whatever kind of fevers coming in future. This will help to build a strong platform. And apart from that, I would like to say the Vamana, coming to my specialty, Panchakarma. So Vasantika Vamana or Sharad Virichana, the Rutuanusara Shodhana having very importance in prevention of these kind of diseases, because while explaining the benefits of the Vamana in a Sosta, Acharya Sushruta says that Kasopaleva Surabeda Nidra Tandrasya Daurgandhya Vishopasargaha. So almost all the symptoms, all the lakshanas which is mentioned by Acharya Sushruta is similar to these kind of viral fevers or kind of different fevers which is pandemic in nature. So it can be upasargika, it can be vishaja, it can be respiratory, or even to the GI symptoms also presented in that Falashruti of Vamana. So these Ritanusara Shodhana can be implemented, and development of a validated treatment algorithm based on the based on the various Jara Chikitsa Adhyayas or context of various texts with the help of experts. That is the essential what I think. And one more thing what I want to mention is Baladishtanam Arogyam Arogyartam Kriyakrama, which is especially mentioned in the Jara Chikitsa. So we have to classify these treatments or these patients based on the bala of the patient. Hina bala patient, Madhyama bala patient, and Pravara bala patients. Based on this only, we have to plan the treatment. Thank you.
I would like to interfere for a second. How beautifully Bhagavad has comprehended the Jara. Jaro Rogapati, Atma, Mrityu, Ojosano, Antakaha, Yakshma, Atanka, Gadabadaha, Sabdaha, Paryayavachana. I just wanted to appreciate his great wisdom. All the elements are there for the COVID.
So thank you, Dr. Sharma. Yes, it's important, and Dr. James was also talking about the algorithm approach. I think what we understood is also that on the one hand, in clinical trials, we have very rigid protocols. And on the other hand, at the practitioner's level, it could even widen up into anybody giving anything. So what we need is an algorithm which has a structure, but still it is flexible. And
I agree with that. Still, but I want to say that instead of going for a very rigid randomized clinical trial or RCT style of research, why can't we depend on real world evidences like big data analysis and all? So we can accumulate the data from entire country, and we can find out some patterns among these practices or the presentation of the diseases. So we need not to worry about these protocols.
Yes. So this is very important. In fact, from Switzerland, there is some people who also, propose some simple outcome-based measures from, clinical practice, comparing with natural course of the disease. There are many alternative models which we could use. And it's very important, however, that whatever we do, it's properly documented, published, not making untoward claims, because even the good work that is done will get lost in that. We don't need to claim anything. We just need to show what is happening with our treatment. So I'd like to now come to Dr. Girish. He's the executive editor of Journal of Ayurveda and Integrative Medicine, and they've been doing excellent surveys. I mean, all COVID-19 articles are special, category in JAIM. And they are expediting the review also without compromising, of course, the quality of the articles. I would like to now hear from Dr. Girish before we conclude. I mean, what is your take on this? How can you, give a helping hand to all these clinicians who really have challenges, like people like Girija Madam? They're very busy, but still taking the trouble to publish. So how can we help, this community to make sure that they are able to publish these findings, in an effective way?
Yeah, certainly. Thank you very much. Namaskar, Swamiji, Ramanurji, Girija Ma'am, Pavanji, Udniji, Dr. Anantarab Sharma, Dr. Jyoti Joshi, Dr. Tripathi, Nesri Ma'am, and others. Actually, I have nothing to say more. That many points are being discussed. I have not treated COVID patients, but since the pandemic started, I got an opportunity opportunity to learn from hundreds of manuscripts. Those were directly or indirectly related to COVID-19, and it was a great learning. First time on a single particular topic, our Ayurvedic clinicians and researchers, they are writing, they are contributing their bit, their experiences to take science forward. That was a very assuring feeling as an editor of a journal. Here I would like to convey some of the experiences and thoughts in next less than 5 minutes. When first of all, congratulations to all of the clinicians, those who are successfully treating patients. When we actually treat, we experience. But when we write, we analyze, we learn, then we teach and we help others. Thus, the process of writing is very, very important. Before we write, we have to document well, and as we go on experiencing, we have to document it precisely, because on the first day we never know what is going to happen in due course of treatment, and afterwards we can think, oh, we lost to document something at the baseline, and hence please treat and please document as if we are going to write the case report of every patient, and every patient's every visit and every visit's every observation is going to be a data. With that sensitivity, we have to document. Along with documentation, what we need is determination, because in this COVID pandemic, Corona warrior, and in that emotion, we will certainly work hard, but we need perseverance and patience to document our findings. And hence, please don't wait. Whatever you have got, of course, this is not for clinical trial because that undergoes some processes of clinical data management, but clinical case reports or case series, please document. I will suggest just four keywords here. First, respect. Then relook, refrain, and report. Respect questions. Respect questions, those are from reviewers, those are from editors, because these questions are representative questions. Tomorrow, whatever our readers are going to ask us, the representation is made by our reviewers, and hence please respect questions, and questions write in such a way that our writing will not invite more questions but answer before they emerge. Then relook our documents. Why we record our findings? Why we keep case papers or case report forms, maybe hard copy, soft copy, whatever? We have to again relook our case records. And Dr. Anandram Sharma mentioned a very important keyword, that is patterns. Of course, we all know that Purusham Vikshasa Gneyo Vishaguttamaha. That is fine, but what is pattern generated in our patients? And that's when we think about patterns, the keywords like some, few, rare, all these keywords, they get a lot of meaning. We need to attach a numbers proportion to all those adjectives. Then respect, relook, and refrain. We have to refrain from claims. Whenever Charak Samhita, Sushruta Samhita, Ashtanga Hridaya themselves, they have classified any disease in terms of Sukha Sadhya, Kashta Sadhya, Vyapya, Pratyakya, Sadhya. Many times we need not to make sweeping statements. We need not to refrain from generalizations, because there are many things that they impact our outcomes. For example, which kind of patients they were referred to us? What was the socio-economic, demographic, diagnostic background of those patients? What was the baseline? And that baseline will going to define our outcomes, and hence we need to document and mention clearly. We have to act passionately but report dispassionately. Let the readers decide what was the message, and hence both the things are important, experience and evidence both. But necessarily clinical practice, clinical case records, case reports, observational studies, they lead to a very rich experience. And experience is also very, very important. What are these samhitas? Those samhitas, they are very nicely codified experiences. Experiences always lead to evidence, but we have to demarcate and respect that line, that these are the experiences. Those experiences, they are going to lead a very fundamental, precise, accurate, pinpoint research questions on which we are going to work further, and hence the experience, clinical experience should be narrated as learning and not as if we are going to save our Ayurveda. Ayurveda doesn't need anything to save itself, but please narrate our learning. Learning, clinical decision making. What was the process of that clinical decision making? Not every times protocol or algorithm can dictate. Many times clinicians' sixth sense, intuition, they can also dictate the or guide the clinical decision making. Please narrate what was the clinical decision making. The problems, what were the challenges in that decision making, in treatment, in diagnosis, differential diagnosis. I respect that Samhitas and the beautiful description of Jwara. In Vaishya Ratnavali, Jwara Chikitsa includes more than 1,500 various formulations. Those are really indicated in Charak Samhita, Sushur Samhita, or Dhrotri. More than 240 Jwara Avastha they have nicely discussed. But our reporting, our thinking, it should not be prejudiced. Charak says that let our thinking be open, let it flow and report as it is. The strengths, limitations, and what we should generalize and what we cannot generalize. All those things, they are important because the patient, what we observe in Kanyakumari, that will be very much different from the one who is going to be in Kashmir. Shillong and Shimoga, very different thing, and hence it is very important to remember what we should generalize and what we should not. What should be the take-home message? What are the new questions? Where we got stuck? We should not be in the position of say Vyaso Chishtam Jagat Sarva. No, we are not Bhagavan Veda Vyas. We are not Charaka. We are a good clinician, yes, and we should narrate our experiences. God is in details, and we should report all related details. Many times, as we go on treating patients, we realize many minute things. All those minute details, they become very important later, and hence it is that particular insight along with experience that we should narrate in our case reports. This pandemic, of course, it is a global challenge, but at the same time, this pandemic has provided a lot of opportunities for us. Ayurveda was restricted by us only in management of chronic, cold, degenerative diseases, metabolic diseases. And this is a time where we are our physicians and friends like Dr. Prashant and others, Dr. Jyoti, they are on forefront and they are treating acute infectious diseases. This is an opportunity to expand the domain of Ayurvedic practice, and hence we need to really work hard. We are challenging our limits. We all are challenging our limits, and this is the time to grow, develop, and expand further. Thus, this particular panel discussion is very much helpful. That will certainly help motivate, inspire Ayurvedic clinicians. Don't just stop at doing. Please write. When we write, we challenge ourselves. We also help others. With this, thank you very much for this opportunity. Wish you all the best. Thank you very much.
Thank you, Dr. Girish, for really summing up very nicely. You covered the whole process from practice to writing and sharing. So, and I think as a journal also, you're doing an excellent service to the community by creating the space where these valuable experiences can be chronicled. So with that, we are coming to the end of our panel discussion. This could actually go on. I mean, seeing Girija Madam sitting there 3 hours, all the clinicians, Tanuja Madam, all busy with their activities. So I would like to, now it's time to thank, all the participants for patiently, being part of this panel discussion for 3 hours. I had planned officially 2 hours because we knew that it would go up to 6 o'clock. So the webinar was actually scheduled from 3 to 6, although we kept it as only 3 to 5 because if you kept it at 6, it would go up to 7. So I think we are almost on time. It's 6 o'clock, and I would like now to invite Dr. Ravinarayan Tripathi, the Vice Principal of Amrita School of Ayurveda, to sum up and extend a vote of thanks to all the participants.
Om Amrita Namo. So, respected dignitaries, those who have the opportunity to be all together on this virtual platform, and our most valued invited guests, my dear colleagues, and all the registered members, those who are already listening to this webinar. So on behalf of the Amrita School of Ayurveda and on behalf of myself, I got the opportunity to extend the vote of thanks. So here my work is actually to sum up also, but already Dr. Ramonan sir, he has already summed up after each person's talk what it was and how it can be concluded. But still, in a very short time, I can tell that whatever I have listened from all the panelists and all the discussants, that we are going through two different things. That is the financial crisis, some emotional crisis, and health crisis. So all these crises has to be taken care altogether. So that's why, first of all, I would like to say that I have gone through some of the papers very recently written by Dr. Ram Manohar about the profiling of COVID-19. So that profiling, or first of all, we have to find out what it is. Definitely, it's a agantuka vyadhi. Definitely, it is because of contamination with the COVID virus, and definitely the first and foremost symptom is fever. So Jwara, what Dr. Tillu sir has told, that there are many types of treatment protocol, but when the patients are coming to us, they may come us in so many different criteria, so many different phases. Some people may come like when they are tested positive. Some people may come to take some medicine as a preventive. Some people may come in the second stage, in the stage when they are already cured, because now so many cases are also there after being cured, after we getting the negative report also, once again they are getting positive. So in different phase they may come to us. So initially there must be a standard protocol so that we can treat the patient in common. Then it can be optimized. I am not telling here as customized, because customized and optimized, a little bit difference is there. Optimized means it may not be the exact care, it may not be the exact method of treatment, it may not be the minimum method of treatment also. It be in between that. We have to opt something according to the presence of the comorbidity. So in this way we can sum up that there must be a standard protocol, and then it can be optimized depending upon the condition of the patients. So it was a very good. Yes, sir, you are listening?
Yes, we are able to hear you, please.
Yeah. So it was a very wonderful discussion, and I could learn so many things by listening all of you. Thank you very much. First of all, I would like to thank Dr. Girija, and I am very happy that we listened that Madam told that she got so many patients from different senior dermatologists, different senior oncologists. So she got so many patients because of recommendation, which gives a good recognition towards Ayurveda also. Then Dr. Jyoti, she treated so many patients by means of all the patients those who have come up by themselves. So that also gives a good recognition towards Ayurveda, that people are now recognizing us, people are now having the faith on this Ayurveda. Then I would like to thank Dr. Udas Agrawal, Dr. Prasant D, and Dr. Pawan Kumar, because they are already involved in different treatment of COVID patients, and they are doing their best, and the outcome is also good. Then I would like to thank Dr. Tanuja Nesri, because Madam has given so many good things, so many strategic advice how to manage the COVID patients. And I would also like to thank Dr. Anantram Sharma, Dr. Girish Chilu, Dr. James Chako, and the team of Dr. Ram Manohar sir, the team of Acharya, those who have arranged such a wonderful program. So finally, I may like to express my sincere thanks to all the people, those who have participated in this experience sharing of COVID-19 management and the treatment protocol. Thank you one and all. Namaskar.
So maybe since we missed some names, I know there are a lot of names. Dr. Unnikrishnan, Dr. Geeta Krishnan were also present. So we should also thank them. Both Dr. Geeta Krishnan and Dr. Unnikrishnan brought in a lot of interesting perspectives and valuable observations to enrich this panel discussion. And I think we will conclude here. I'd like to specially thank Swamiji for being with us. I didn't expect that he would be willing to sit for such a long time, and we have arranged this in a very different space. So he has really shown interest and support by being with us for these 3 hours. Thank you.
Thank you, Ramji, for arranging this wonderful interactive session and making us enabled to hear from horse's mouth. If I am permitted to call Prashant the horse. Thank you very much. It was good. It was fantastic. Thanks a lot.
Thank you.